Meeting of the Tennessee Advisory Commission on Intergovernmental Relations. To the members, I would call your attention to your material that is in front of you in your notebook and the agenda for today's date on the front page, which tab 1, which is the minutes of the June 2025 meeting. The chair would entertain a motion to receive those minutes. So made. Is there a second? Thank you. Is there any questions or comments about them? There's no objection, then they stand as approved. There being none, the minutes are approved. I'll ask Dr. Lippard now to bring a commission and a staff update. I think he has some very substantive report for us today, so I will turn it over to you, sir.
Thank you, Chairman. So for the commission update today, I'm going to be providing a summary of the ad hoc subcommittee meeting we had on August 28th on education, specifically on the fiscal capacity model and distortions in the model caused by virtual school student counts, the effect of Greenbelt property assessments on fiscal capacity, and the fiscal capacity of counties with large tourism industries. If you turn to sub-tab B of tab 2, you'll find the memorandum that was provided by staff to the subcommittee members, and in that memorandum on the very first page, the 3 bullets there summarize the information that from the staff presentations made by Michael Mount and Ismail Tanwi to the subcommittee, and they say that staff analysis came to the following conclusions. First is that including virtual school students in TACIR's fiscal capacity calculation can increase the fiscal capacity of a county that hosts a virtual school. Keeping all else the same, this decreases the fiscal capacity of the other 94 counties. Including virtual school students can also decrease the fiscal capacity of the host county, which increases the fiscal capacity of the other 94 counties. Whether a county's fiscal capacity increases or decreases depends on the effect of the virtual school students on that county's fiscal capacity variables. So it basically depends on how everything else in the model is kind of working with each other on which effect it has. They also found that a decrease in residential or farm assessment in a county because of Greenbelt or for any other reason can increase or decrease the county's fiscal capacity as calculated by TACIR. So the effect on state funding varies across counties. And finally, that tourism can increase a county's fiscal capacity, which can decrease its state share funding percentage under the Tennessee Investment and Student Achievement Act, or TISA. So that's a summary of the presentations that Michael and Ismail gave to the members. There was an extensive conversation during and following those presentations. And if you turn back to the memo itself, tab 2 itself, you'll see that after that discussion, the members of the subcommittee made one recommendation, voting unanimously to recommend that the full commission recommend that the Tennessee Department of Education begin collecting residency information for virtual school students. So currently there's a state Board of Education rule that that public virtual schools have to report their residency information to the county that's responsible for that school, but there's no requirement that that residency information be reported to the state, and the recommendation is to require that would make any tracking and analysis of virtual students easier, at least in terms of the residency requirements. In addition to this, and what we would like to do is we would like to wait on voting on that recommendation until we complete some further analysis that was requested by the subcommittee. And so that'll probably be at the next meeting or possibly the meeting following that. Because in addition to that recommendation, the members of the subcommittee asked that commission staff for further analysis regarding whether out-of-state students are enrolled in virtual schools in Tennessee. And this came out of this request was made because in our initial analysis we found a handful of students in one virtual school, 4 or 5 students, their residency address that we obtained from the county show their residency is out of state. As we said at the subcommittee meeting, we felt this was probably because of some kind of glitch in reporting. And that's what we're being told, that it was because these were students that were already enrolled in virtual schools in other states under the same vendor before they moved to Tennessee, and their residency information had just not been updated. And we suspected it was something like that, but we are going to continue to confirm that there are whether there are any out-of-state students enrolled in virtual schools in Tennessee. The members also asked us to look at whether other states enroll out-of-state students in their virtual schools, to look at the difference in costs between serving virtual school students and brick-and-mortar students in Tennessee and other states, and whether other states account for tourism in some way in their education funding formulas. So we will, like I said, staff has already done a lot of the work on analyzing these questions, but we've got a little bit more work to do before we report back to the commission. So in addition to the memo at subtab B, there are also the minutes from the meeting, which are at subtab A. Also, anyone who wants to watch the entire meeting, it is available as a video on our website under the meeting tab for August 2025 meeting. If you have nothing else to do, yes. And then finally, the attachment C is the presentation, the slide deck presentation that Ismail Tanwi gave to the subcommittee members at that meeting, and it has a lot of the same information as the memorandum, but it's in an easier to digest format. And then finally, just one last thing on the commission update, Mr. Chairman, is I would also like to again thank the subcommittee members. We had an excellent discussion on that at that subcommittee meeting, and it's really helped guide staff's look at the information that you all asked us to look at. And then if there are no questions on the commission update. Okay. Moving on to the staff update, we have a couple of acknowledgments we'd like to make. First of all, our office manager, April Sibley, has reached an important milestone, April. 20 years of service to the state of Tennessee. So,
She's working right now.
never stops. And then our information and technology manager, Mark Patterson, who I'm sure is watching, as he always is, recently completed advanced training in secure development. And this is far, far from the first professional certificate that Mark has completed. But I wanted to take this opportunity just to acknowledge this, because I don't think we acknowledge our support staff as enough. Normally when we're doing staff updates, we're talking about education accomplishments or training accomplishments for the research staff, but the work we do to support the commission as the research staff would be impossible without the work of our support staff, including April and Mark, and of course our web development and publications manager, Teresa Gibson, and of course our director of administration, Carrie Jones, who is in the hall lurking. So I just wanted to take a moment and recognize their accomplishments and their support also. And Mr. Chairman, that completes the staff and commission update.
Thank you, Director. Are there any other questions for the Director regarding his report? I do appreciate it, and I want to add my comments of appreciation to the ad hoc committee that have studied this issue. It's clear from reading the minutes and watching the video that you've done a really good, thorough job vetting this issue. And I concur with the Director that the one recommendation that has come out to date, asking the state to collect residency information on participants in the program, we will put that on the calendar for next time, because from the minutes of the meeting, there may be other recommendations as well, and we'll put them all together in one package at the next meeting. So I presume there'll be no objection to that, but I can't thank the committee enough. All of you did under Chairman Brooks' leadership, you did a very, very fine job on a very nettlesome issue at times, I'm sure. All right, tab 3, public chapter 445, a Continua of care. I believe we have Dr. Strickland has a panel assembled for us. I will defer to you, Dr. Strickland, if you will ask your panelists to come forward. We don't ask questions until the end of the meeting. That's right. While they're finding their seat and assembling the panel, I want to also agree with the director on his comments on our technology person who was in here earlier, who very articulately explained to me how the system works, which I want to share with you. We now are able to have at least 3 people on the system. I think in times past only 1 person at a time could be on the system. So in the instance where the panelists, for example, we have 3 people who are speaking or their system, their equipment is turned on, I will mute so a member can ask a question, but it's a little bit more feasible for members to participate without waiting to get a hotline, if you please. And with that explanation, Dr. Strickland, I will recognize you for purposes of starting the meeting and getting our illustrious members introduced.
Thank you, Mr. Chairman, and good morning, Commissioners. This is, as just noted, tab 3 on the Continua of Care for Homelessness Services in Tennessee. Each year, thousands of Tennesseans are left homeless, with many more at risk of becoming so. And across the state, there are numerous organizations that try to help, many of them small local nonprofits, working to provide people who have become homeless with needed services and housing. But the resources and capacity of any one organization alone is always limited. And while those serving in this field all share a common goal of resolving homelessness, they may have different strategies or priorities for doing so. To better combine and coordinate their efforts, the Federal Continuum of Care program under the U.S. Department of Housing and Urban Development provides community forums for different homelessness service organizations. Still, the landscape of homelessness services is complicated. Not every service organization participates in its local COC.
Dr. Strickland, if you could just speak closer to the mic or speak up. Some of us, notably me, are having a hard time hearing.
Sorry. There are some other federal programs related to homelessness services that work separately from COCs. And while some local governments in Tennessee partner with their COCs, at present the state government has no formal relationship in law with any of the COCs. Moreover, just like homelessness services organizations in general, COCs are confronting enormous challenges with finite resources. This year, Public Chapter 445 requested a commission study of the Continua of Care in Tennessee, how they might be improved, and how they might compare to Continua of Care in other states. There are 10 COCs in Tennessee, their coverage areas ranging in size from 1 to 23 counties. COCs are broad groups whose members include nonprofits of all sizes and sometimes state or local governments. They seek to coordinate outreach, assess the needs of clients who are experiencing homelessness, and refer them to appropriate services, a process known as coordinated entry, and they organize and help review nonprofits' applications for federal funding. Additionally, COCs are charged with collecting data on homelessness to help better inform needs in policymaking, including both conducting an annual point-in-time count of how many people may be homeless on a given night and maintaining a database called a Homeless Information Management System, or HMIS. As part of the staff's research, several key stakeholders have been identified who are knowledgeable about continuum of care and homelessness in Tennessee. And today you will be hearing from 4 panelists. 1, Scott Foster, Executive Director of the Journey Home, a nonprofit in Rutherford County. Aaron Reed, Executive Director, Knox Office of Housing Stability for the Tennessee 502 Continuum of Care, covering Knox County. Victoria Lake, Director of Community Health Institute, West Tennessee Healthcare, representing the TN 507 Continuum of Care, which covers most of West Tennessee. And Matt Yancey, Deputy Commissioner of Behavioral Health Community Programs for the Tennessee Department of Mental Health and Substance Abuse Services. And also Nehru Govind, who is the Director of the Office of Homelessness Services within the Tennessee Department of Mental Health and Substance Abuse Services.
Thank you. And we will take We will start.
Let me check. Are we good? Yes, we're on now. Okay. We'll see if we can catch that with the good eye. Good morning again. So happy to be here this morning. My name is Scott Foster. I am the executive director and founder of the Journey Home, which is a nonprofit faith-based organization in Murfreesboro, Tennessee that serves greater Rutherford County, providing resources for those who are experiencing homelessness and otherwise disadvantaged in our county. We have a day center that combines resources for housing placement, job placement, health and mental health services embedded at our site. We also have 33 homes and apartments in our county that we use primarily for long-term transitional housing for families with children and individuals who are experiencing homelessness. This morning, just wanted to share a little bit of a brief history about the Continuum of Care program. I have been involved in homelessness work since the beginning of 2005, so a little over 20 years. And the Continuum of Care program predates me slightly, but homelessness is a complex issue. In fact, sometimes we can't even talk about the number of people that we have in our communities that are experiencing homelessness because definitions are different. It's not a static demographic. You know, people go in and out of homelessness. They get back into housing and back into community. So it's a complicated issue for any area to address. Also, homelessness looks different in urban centers than it does in suburban areas and certainly in rural areas. What the Continuum of Care program was designed to do was to create an intentional forum for community stakeholders from a broad range of disciplines to come together for planning and to assess, to gather data and to assess the assets they have available to them, the resources and the gaps that they need to fill in trying to eliminate homelessness, not just for those who are experiencing chronic homelessness, or long-term homelessness with often disabling conditions, but also for others who may be experiencing situational homelessness or episodic homelessness in their areas. And it has been a very good platform for creating a foundation for collaboration among agencies, both public and private, faith-based and secular. It has been a very good way to bring together people from the health community and the employment community and the housing community, also our local governments. However, as was mentioned earlier, we never get everyone involved, so there are often segments missing. Also, the HUD Continuum of Care program specifically deals with funding from a couple of grants. Yet there are other programs that these member agencies or participating agencies deal with, maybe related to reentry or maybe related to health or mental health or recovery funding or other direct housing funding that's not related to HUD that is kind of not part of the same program. So it is always somewhat challenging to get a single concept working that will work in all the cases. But it has been very, very good, particularly for the intentionality of planning and evaluating, very good for data gathering in our communities and putting together ways that agencies can collaborate with one another to bring these resources to a complex issue. Where it has struggled is actually in some of the administration and management when the COC bodies, and there are really three different forms that it can take in an area, get together and try to do work as opposed to coordinating or being a foundation for collaboration of agencies to do work. It tends to be cumbersome and oftentimes does not deliver services in a timely way. And actually can create some obstacles to care. So it has both good and some good issues and some struggles. But overall, it does bring our communities together to look at our problems, the gaps that we have, and come up with solutions in a very organized and planned, data-informed way.
My name is Erin Reed. I'm the Executive Director of the Knox County Office of Housing Stability in Knoxville. We are the COC known as TN 502. Dr. Strickland and Scott have done an excellent job of giving you an overview of what the COC program is, so I'm going to dispense with that part of my notes and just talk through really two aspects of the COC program that have been really productive and helpful in Knoxville and Knox County. One of those is in the federal code, it mandates that COCs have a process for selecting a governing body to make decisions for the COC. That mandate to govern the system has been extremely helpful in bringing local government, nonprofit partners, philanthropy, and even some for-profit partners into the discussion around homelessness on the foundation of the continuum of care. The other piece, which both Dr. Strickland and Scott mentioned, is coordinated entry. Coordinated entry in many ways is the foundation of COC programs. So we are mandated by federal code to create a system to assess the vulnerability of people who are experiencing homelessness and to prioritize them for access to services by that vulnerability, and then to match them the best that we can according to their needs. And with the homeless population growing like it is everywhere, we have limited resources to respond as a community. And so having that system to assess vulnerability, to figure out in the moment where resources need to go to have the most impact has been really helpful in Knoxville and Knox County. Scott, your presentation was very fair. You also mentioned that coordinated entry can be clunky. It can sometimes get in the way. That is something that we are working very hard to address in our COC. We're looking at some pretty major overhauls to our coordinated entry system to try to remove any roadblocks we can. We have so many people who are experiencing homelessness. We don't want anyone to not be able to access the services they need simply because, you know, our coordinated entry system isn't fast enough. So we're taking steps in our COC to make it faster, make it more efficient, increase the number of access points across the community so that we can have a true no wrong door approach. Those are the two things that I really wanted to convey today, so thank you.
Hi, my name is Vicki Lake, and I'm with Jackson-Madison County General Hospital. We are one of 2 hospitals in the country that serve as a collaborative applicant for our continuum of care. And I represent TN 507, and I want to first thank you all for allowing us to come today and speak about rural homelessness. And then I want to thank Senator Ed Jackson, who represents several counties in our continuum of care, for coming and supporting us, and my colleague Roseanne Downing, who is here today with me as well. Roseanne and I met in 2002 with the beginning of the continuums of care, so we have been involved for many years. First of all, just to give you an idea of our continuum of care, we serve 23 counties. We serve all of West Tennessee, absent of Shelby, and then we serve Stewart, Houston, and Humphreys County in Middle Tennessee. We have about 10,500 square miles and a population of about 571,000 that we serve. Just to build on the previous 2 speakers, we're going to tell you a little bit about how our COC operates. We have the availability for our coordinated entry. People can call or they can go online with 2 agencies and click a need help icon and receive services through our coordinated entry. Last year we had over 5,000 people go into one of those means and ask for services. Out of that, we had about a little over 2,000 people, unduplicated people, in our HMIS system that was mentioned by Dr. Strickland that receive services. That's housing or supportive services to keep them stable. Of the remaining 2,000 clients, 3,000 clients, they receive resources and diversion. And I want to note, out of that 2,000 clients, we have a special program for youth called the Youth Homeless Demonstration Program, which is also funded by HUD. And we serve 223 homeless youth between the ages of 18 and 24 and got them into housing and got them stable. The average time spent in homelessness was 2,010 days, and I want to explain this high number. We received funding from HUD for to specifically deal with chronically homeless after COVID. And chronically homeless are individuals who have 4 episodes of homelessness in 3 years. And so our number of days increased because we were primarily focusing on people who had been homeless a long time. So that's why that number, 2,210, looks high. In reality, it's between 30 and 60 days that we have people homeless in our system. We usually find them. And just to note, there were 2 forms of this special funding, and our continuum of care was one of 4 in the whole country that received both the urban and the rural homeless grant dollars to work with chronically homeless people. The average time of homelessness for first time is 130 days, and the DV days, domestic violence, which in HUD's law, if you are fleeing domestic violence, you are automatically homeless. And the time frame for us was about 29 days. To serve all of these people, we have in our continuum of care, not as the speakers have mentioned, other resources in our community, but actually in our continuum, we have 32 emergency beds. That means keep them for a specific short length of stay. Transitional care, which is a little longer. We have 32 beds in our 23 counties. And we have 274 beds for permanent long-term housing. So just to give you the numbers. We had only 73 people return to homelessness after a year. We had 618 people who are homeless for the first time. And 735 people left our program because they got stable employment and the rent was paid by the client. They were living with family and friends, they went to a halfway house, or they went into substance abuse treatment. We do the annual point-in-time count, and just to give you our last numbers, in 2024 we counted 765, and in 2025, in January, we counted 747. The day we counted was probably the coldest day of the year to that date and time. It was 22 degrees the day we counted the homeless. But I will tell you that because of the organization of the COC and the sophistication and the hard work of these agencies and individuals, our point-in-time count has decreased 5% for the last 5 years, each year. When we meet just organizationally, we have about 30 people attend our quarterly meetings. 10 agencies in rural West Tennessee receive funding, and last year we received $4.7 million. We have weekly housing navigator meetings, which go to the coordinated entry. Anyone that was deemed to be homeless the week before, we discuss one by one to get a plan for them as a group. We do bi-weekly case conferencing meetings where all the agencies in the continuum of care meet to go through the names and see who has openings and who we can get placed. And then we have quarterly street outreach where all the agencies come together. We've been doing it in Madison County, which is our largest county, and we go out into the encampments. We have about 9 encampments in Madison County. We go out to the encampments and do street outreach, try to get them on a case management list, try to get them to come in and get housing. And we've been doing that. I think we're in our 2nd year of doing the quarterly outreach. I will say the Department of Mental Health funded the Project Rural Recovery, where our one of our agencies, Pathways Behavioral Health Service, has a mobile integrated primary care mental health bus. They've been gracious to let me use it 4 times a year in Madison County. So the bus does come. We have legal services available. We have all the services there at our local soup kitchen, and we're there from about 7:15 to about 2 in the afternoon. We have, we're very successful. We think we are. We do have bumps in the road, but we all come together. We've known each other for many, many years and have worked very hard on this very complex. You take 2 steps forward and 1 back in homelessness. And I will let you know, I did provide the staff our strategic plan and our youth plan. And also, before you, very quickly, there's some little cards that are neon colored. As a collaborative applicant, we get some planning dollars. We have these little cards in neon colors for all our 23 counties. It has all the resource on it. We have them in Spanish. I've given you a Spanish. The county executive from Tipton County, I provided yours for you because I knew you were going to be here. And so we provided Tipton County. I provided an example of a Spanish card from Gibson County, and we also have a veterans resource cards. And these are very, very popular. We give them to all the state departments, all the homeless providers, law enforcement, anyone who serves people in need. And I want to again thank you for the opportunity for being here, and I appreciate Senator Jackson coming and Roseanne Downing coming with me.
Thank you, ma'am. Sir, you're next.
Well, good morning, Mr. Chairman, members of the committee, TACIR. I'm Matt Yancey, serve as Deputy Commissioner with the Tennessee Department of Mental Health and Substance Abuse Services. To my left is Mr. Nehru Gobin, who serves as our Director for our Office of Housing and Homeless Services. Nehru's got a wealth of information, so I'm really happy to have him here with us this morning. It's really an honor to briefly touch on the housing and homeless services that we fund through our department, specifically those programs that have relevancy to the COCs. As many of you are aware, our department's mission is to create collaborative pathways to resiliency and recovery and independence for people in our state living with mental illness and substance use disorder. I bring that up just to underscore that point about collaborative pathways. We fund through grant contracts approximately 300 different organizations across Tennessee to support early intervention work, prevention work, our crisis services, to provide treatment for the uninsured indigent population, to support criminal justice related programs, including our recovery courts, as well as recovery support services, namely housing support, employment support, and peer support. This slide here represents the 15 programs that we fund out of our Office of Housing and Homeless Services. Many of these programs focus on really people with mental illness and substance use disorder, but people who are notably vulnerable because these are individuals coming out of hospitals, coming out of crisis stabilization units. These are programs that support people that are re-entering the community from the justice system, as well as there's a focus here, as Vicki referenced, on young adults. We know that young adults, notably those coming out of state custody, are at higher risk for homelessness. But for the purpose of this brief presentation this morning, Director Gobin is going to focus on 3 of the programs that have the most interface with the COCs that we fund through our provider network. Those programs being the PATH program, that's the Projects for Assistance and Transition from Homelessness, and as well as our regional housing facilitators and our consumer housing specialists, all of which who fall under our Creating Homes initiative, which has really been a bedrock program for our department, started by Commissioner Williams back in the year 2000. So at this point, I'll turn it over to Director Gobin.
Thank you, Matt. Good morning, everyone. Thank you for having us here today. As Matt said, my name is Nehru Gobin. I serve as the Director for the Office of Housing and Homeless Services with the Department of Mental Health and Substance Abuse Services. One of the most directly related programs to our state's HUD COCs is our PATH program, as Matt had indicated. This program is a SAMHSA federally funded formula grant program that is all states in our nation is awarded these funds through a formula grant. And the purpose is to provide homeless outreach services for the purposes of trying to identify individuals in our state who may be experiencing mental illness or substance use disorder, to try to get them connected to services that will kind of get them towards that path towards recovery and resiliency and independence. So this program intends to go out to have case managers to conduct those outreach out in the community. We're talking shelters, we're talking out on the street, even sometimes in the jail facilities and what have you, to try to find out and to establish a rapport with folks to see what can be done to get them connected into much needed resources in there. And so that graph that you see there is just an illustration of the process that's involved from initial contact to engagement and developing that rapport, enrollment into the PATH program, and trying to connect them to services before you can exit them out of the PATH program. The next slide. So this just gives you a colored map that kind of gives you an idea of where our PATH services are provided in Tennessee. As you can see that, these are hardest hit in some of our more populous counties. But we want to emphasize the fact that, that our continuum mental health services and substance use delivery services in the department is really connecting folks not just with our PATH services, but a lot of treatment programs and service delivery programs in Tennessee. For example, is our crisis services continuum, our behavioral health safety net program, so that even in those counties that may not be highlighted in this particular map, that we are very intentional as a department to make sure that services that are needed for even those who are experiencing homelessness, that they have direct access to those services as well. This one is our regional housing facilitators, as Deputy Commissioner Yancey had described. Our flagship program is known as Creating Homes Initiative, and that begs to answer the question is, what can be done and how do we impact opportunities to create housing opportunities for Tennesseans who are in need, who are experiencing mental illness and substance use disorder? And the answer is through our initiative by way of our regional housing facilitators. These are grassroots professionals. They are employed by community-based behavioral health organizations so that they have that background and that setup in their home base to really work at being at the center of a table, at any table, to help to collaborate, strategize, and develop opportunities to pursue grant funding opportunities or other resources to establish and create new housing opportunities. I'm fortunate that some of our panelists here have been directly involved with our regional housing facilitators of our participation of their HUD meetings, sometimes in collaborative grant efforts, opportunities, or what have you. And so they are really essential to our entire services in addressing homelessness in Tennessee. And so as a result of that, we're proud to say that their efforts have collaborated into the leveraging of over $1.3 billion since the inception of the Creating Homes Initiative to create over 36,000 housing opportunities to date. And our final program that I wanted to point out today is also our consumer housing specialists as a component of the Creating Homes Initiative. These are what I like to consider our unsung heroes. These are certified peer recovery specialists who are trained in providing education, trainings, addressing what may be misconceptions across the community for folks who are experiencing mental illness and substance use disorder, and particularly those who may be experiencing homelessness or at risk of homelessness, to help educate the community in what may be true, what not necessarily not be true, and also to help them identify what resources and housing opportunities that may be out there for them, and also for advocates of theirs, including their families or case managers. So the image that you see there is our homepage for our Housing Within Reach website, which is essentially a database that we collect, our specialists collect information about housing options that may be targeting opportunities to provide housing for folks who are experiencing homelessness and experiencing mental illness and substance use disorder. So this is constantly being made up to date as soon as we identify, or even if we have been able to fund through our CHI grants to create new housing opportunities. Each of these programs probably have the most direct touch to our HUD COCs across the state. by way of engagement, partnerships, and relationship building to impact the community and attendance to their meetings and other venues of that nature. So for the sake of time, I'll pause for a moment to make sure that I'm adhering to the request on our limited time.
If you would draw your remarks to a conclusion.
Yes, sir.
Okay.
Yes,
I believe
yes.
you've reached your, surpassed the limitation that was offered or suggested, but we appreciate what you're saying, so just draw it to a conclusion for us.
Absolutely. Well, in essence, what we do at the Department of Mental Health, in particular with the Office of Housing and Homeless Services, is work to understand that, no one of us can work and achieve addressing the challenge of homelessness by ourselves. And so essentially our programs, including Creating a Homes Initiative, is intended to establish a tool to provide collaboration, strategic planning across many stakeholders in Tennessee, understanding that what we can do collaboratively together to make a greater impact for those who are in most need. And so essentially all of our presentation today is really highlighting that from our department, not just with Housing and Homeless Services, but our entire continuum of behavioral health services across the state.
Thank you. Now, we'll open the floor for questions. I'm sorry. Representative Parkinson, you're recognized, sir.
Thank you, Mr. Chair. Was there anything else in your presentation that you did not get to say?
No, sir. No, sir. I'm prepared to answer questions as needed. Yes,
okay.
Sir.
Thank you. Thank you, Mr. Chair.
Are there questions for the panelists today? Yes, Mayor Frank.
Well, thank you to all the panelists. I just have a couple of questions and comments. One, Scott, I believe you mentioned how complex the issue is, and as we've heard today, I mean, you have mental health components, you have senior citizens, you have a life crisis situation. For a little while, I served on the Tennessee Valley Coalition for the Homeless, which is a COC. And one of the things I found is, I mean, I'm an elected official, but it is extremely confusing. So, it took me months to even understand what they were trying to do. And I think, I'm looking at this public chapter and what this body is tasked with looking at, which is there a way to do it better? I guess I'm going to ask, are there structural changes? Is there some, you've got this program operating under HUD. You have local and state officials who have care, compassion, a desire to help, but there really isn't a roadmap for us to be able to understand that. And I look at my county commission a couple of years ago. They had some workshops to try to understand homeless. There's the compassion, there's the care, but then there was no path forward other than just giving money to organizations. So, I guess I'm talking in terms of structure. What would a structure look like? Is that some kind of accountability measure? Are we looking at that in terms of programs? Some of the programs, for instance, recovery courts that you mentioned, Matt, those work very well, but are we actually measuring them? Are we asking them to do more or improve their client numbers, or is it just the annual grant that goes out every year and we're just going to keep on doing what we're doing? So, I mean, is there some kind of better structure that can be put in place? And on top of that, are there other states that are doing it better and that have a gold standard, if you will, for meeting the most needs? I know there's a lot kind of wrapped up in there, but it's commentary mixed with a little bit of questions.
Would someone like to take that? We'd like to hear your ideas, ma'am.
Thank you. So that's a really good question. Across all COCs, there are 7 system performance measures that we all have to feed our data into. These measures are consistent across COCs. They are things like the length of time that people remain homeless, the number of people who return to homelessness after being placed in housing, the employment and income growth for people experiencing homelessness. So, I mean, really substantive measures of how well a system is doing. So I wonder if an annual state-level report of how all of the COCs are fulfilling these system performance measures could be a place to start.
I just want to comment that the performance measures also are collected at the agency level, how they did with their homeless population, as well as the continuum level. So every year when we have responded to HUD as a continuum, we have to put how we did on those. So HUD is holding us accountable, knowing the complex nature of homelessness. Now, one of the comment, it would be a great idea if we could bring that together in a state report.
But would it, may I have a, if there's no objection, I'd like a follow-up here. What are there agencies that are not a part of the continuum that may be working on homeless issues? Would that data be brought into a statewide report? Is there a way to do that? Or would we?
It would be on a volunteer basis unless they were receiving their funding from another state agency who asked them to collect the data as a part of their funding.
Are most, if I may, unless there's objection, would you say that a majority of the agencies throughout our state that provide services for the homeless, are majority of those are in the continuum?
Yes, the majority are. And I will tell you the Department of Mental Health has performance measures that the agencies have to input their data into a state database, and they have analysts who look at those data and do performance measures for the agencies, whether it's recovery housing, recovery court, alcohol and drug treatment, intensive outpatient. The Department of Mental Health does provide a structure around that the agencies do report their data.
All right, thank you. I think the gentleman on my left had a comment to make, and then I'm sure the members have questions. So.
Sure, and I just wanted to go back to your core question: is there a path forward to make a structure that may be more useful? One of the keys in solving homelessness anywhere is pairing people with the right resources. Homelessness is not there's no generic one-size-fits-all solution. It takes resources and relationships. There is an interdependence between housing, economic stability, and health, speaking very broadly in those categories. And, as I've worked with different agencies in the state government, everybody has it on their agenda. There's a homeless component if you're talking to the Department of Correction, or if you're talking to Department of Mental Health and Substance Abuse Services, if you're talking to THDA, if we're talking to disability and aging. We all have these particular needs. When I talk to Medicare providers who we work with in our local area, about their needs for long-term care and the costs that we have due to homelessness that show up in our emergency rooms and show up in our jails, and we need to be able to pair people with the right resources, and that needs to be a menu, a broad array of resources. So the potential, and THDA has organized this starting a couple years ago. There is sort of a monthly call of different agencies to talk about resources that are available or to make people aware, providers and COC members and that kind of a thing aware. But maybe an interagency council similar to the way the federal government does that, that agencies are creating a comprehensive strategy together. These different agencies that have different specific focus areas, because all of these focus areas touch homelessness in some way or another. But it will help for folks that are really knowledgeable about building housing. The THDA kind of folks. They know how to do that piece of it. but there may be other services, particularly related to mental health or substance abuse or economic development, that a different agency would be able to come in, and they could each sort of coach each other on how to write grant opportunities, how to write partnership opportunities that would work in a more cohesive way. And also, I think the COC structure, to the question, are most agencies that provide services to homeless people members of COCs? I would agree that most people that have larger scale programs that get government funding and that kind of thing are. But to be quite honest, most of the work is done by small groups out of churches and civic groups and community groups within small areas. And in the rural community, that looks different than it does in the big cities, but sometimes they don't have access to really be involved or really understand. And when you're talking about the fact that it's confusing and people don't know where to start, that is one of the things that the coordinated entry system was sort of invented for, primarily focused on permanent supportive housing. But we can use the good things, particularly the foundational things, the planning, the strategizing, the data gathering, that are just solid aspects of the continuum of care program, to maybe build something at a broader level that creates a unified strategy for the state, and is not just maybe an announcement or an invitation to come find out about new opportunities, but actually to create a strategic plan.
Thank you. I think Senator Yarborough is waiting for the floor. Senator, you're recognized.
Thank you. Ms. Lake, I was struck by the vast geographic scope that you're covering, and could you help us understand if there are, I assume that just creates transportation, outreach, access to care difficulties. Are there particular issues that arise there, or things that the more rural regions need in order to deal with that kind of structural issue?
That's a wonderful question. We do serve 23 counties, 10,500 square miles. In the coordinated entry process, we have what's called housing navigators, and our housing navigators are geographically spread across that area, so that when we get someone who calls or fills out that need help, once we determine what county they're in, then we filter that. We refer that person to that navigator in that area so that they can best do the intake and assessment to work with that person to best meet their personal needs. Transportation is an enormous issue in rural areas, as you know, and across the board of all social services. But what we do in our strategic plan is look at where our gaps are and try to, when our annual funding comes or from other sources through other state agencies and the federal government, try to match where those needs can be. And funding directly for rural areas would help solve that, additional funding, because we are spread thin with the 23 counties. If we could have direct funding available just for rural areas would be wonderful. And developing the infrastructure around that and using the existing agencies to build their capacity to be able to work with this. But transportation is a large issue. In East Tennessee, while it may not be mileage, you may have a mountain, and that takes time to go over. So it's not only in rural West Tennessee where we are spread out, but it's all over the state in the rural areas.
I think Senator Yarborough had a follow-up, and you're recognized, sir. Representative Parkinson is waiting, and then Councilman Chase is waiting. I'm sorry.
I have one more, and it might actually be better directed to, I think, Ms. but I'm not sure. So the question is really around young people in homelessness. I think there are a lot of us that it doesn't fit our image of what the homeless population is, but it's a significant part, and there's a high need to actually prevent that. But a huge number of that is going to come, assume, from state custody, like people that are cycling out of foster care or juvenile custody or something of that nature. How is the communication between those sort of discharging agencies, if you will, and the continuum of care? To sort of, as people are, when people exit state custody, we should know if they're going somewhere or don't have a place to go. Do we actually communicate that to the Continua Care and those agencies? And if not, should we do something to improve it?
We've had our youth homeless grant for 2-3 years, and we've served 223 people. Some of them are aging out of foster care at either 18 or 22 or somewhere in between. And we do work with Department of Children's Services. They do make referrals to us. We have actually housing navigators, just like we do at the adult side, who specifically work just with youth homelessness. We find youth homelessness is a lot of couch hopping, where the young people are just moving from friend house to friend house to friend house. And some are living, they have jobs, they're living in their cars. And even they have jobs, but they are living in their cars. They have nowhere to go. But we do work with Department of Children's Services on when they are released from foster care. Now, and we have a very robust system. We have 4 providers of services in our area for youth, just dedicated to youth homelessness. And so it is an issue, but we do work with Department of Children's Services.
Representative Parkinson, you're recognized, sir.
Thank you, Mr. Chair, and thank you all for this information. It's great. I think you mentioned TSDA. What is that? Oh, THDA. Okay, I know. Okay, thank you. I thought that you said TSDA. Okay, and can somebody tell me? It doesn't matter who are the 10 Continua of Care agencies in Tennessee?
So there's a lead agency at each one of those 10 COC. A COC is just defined by geography. So ours is just Knox County. Theirs is 23 counties. So each lead agency, most of them are nonprofits. Ours is a quasi-governmental entity. I could find a list of those if you want them. I don't have it off the top of my head.
Okay. If you can get that back to us, that'd be great. I appreciate it. Thank you. We got that? Okay. Thank you.
All right. I believe Councilman Carlisle is waiting for the floor. Sir.
Thank you, Mr. Chairman. The lack of the beard is probably startling. I was leaning over to Mr. Peach and telling him my daughter started to tear up. I've had a beard for 15 years and shaved it, and it caught her off guard. Very, very greatly. She's 9. Yeah, so thank you, Mr. Chairman, and thank you for all the work that all of you are doing. I know, like Representative Parkinson, homelessness is prevalent in a place like Memphis, Tennessee, and for a wide variety of reasons. I agree. It's not a one-size-fits-all, especially when you talk about like from A to Z, like emergency shelter, like engagement, emergency shelter, all the way through transitional housing to stability. And then you've got everything from individual males, veterans, to family. And where we run into a buzzsaw is continuity of care for the family units. We have a significant amount and an undersupply of emergency shelter for family. And where we've learned, and this is, and I'll invoke him, and I hate doing it because a lot of people are, but Fred Smith was a great data-driven guy, and because he was a veteran, he was involved in the Memphis Union mission heavily. And what his data team found out in case management and the continuity of care is geography is everything. It's very difficult to get somebody through case management work from A to Z, from emergency shelter all the way to stable housing and workforce, because we lose them somewhere in the system on and off the campus. And so I am astonished at some of the work that you do covering the counties that you do. I'll be interested to see the thought process, and obviously it's resource about how your counties are defined, kind of like a congressional district might be, or how your coverage area are, and you're able to manage that case management. Because even, I think you mentioned Madison County had 784. I think just in Memphis alone last year we had 1,200, except for your geographic spread is much larger than ours. So we have a density issue, and we're still losing people in a geography problem, meaning we can get them to emergency shelter, but then I've got to get them on a transportation, on a public transportation, which is an issue for us of its own. But I've got to get them 3 or 4 different places to get them the services they need, and the battle was already stacked against them. So as you are going through this process, my ask to the staff, and I know this is a lot of commentary, but it's really an ask to all of you to study the geography and the resources necessary and the success rates. Because when you look at 5%, it's not that those lives don't matter, but you're spending $4 or $5 million a year, and you're not hitting. We're still hitting that same cycle, kind of grasping at it. And the question might just be as simple as, how can we get people, how can we make it simpler for them and easier for them? And that's always been I think the thing, and I got it. Like in the city of Memphis, and this will be my last comment, I'll be quiet. We have an abundance of vacant property. What we need is the ability to aggregate that property and redevelop that property for a wide variety of uses that can benefit the community. And that could be anything like the Memphis Union Mission, which is located at Danny Thomas and Poplar Avenue, right in the heart of downtown, right next to a bunch of resources. So I'll be interested to see that study, because I feel like geography and real estate is often left out of the conversation, and we go to technology and management and these other things, and it may just be as simple as, can this person walk across the street to get the help that they need? Or are we going to make it as hard as possible because they've got to go take the 50 bus line an hour and a half to get out to where the psychologist is and then get back to go get drug tested so they can go interview for a job? You're going to lose them. And so those are the things that I've seen. I hope that we can study some of those. I don't know a way to tangentially do that, but I know that the geography and the resources behind that are important with the case management. And I just am grateful for all the work that you do. Thank you, Mr. Chairman, for the latitude.
Thank you, Representative Parkinson. You're recognized, and I believe we're going to try to draw this discussion to a close. We want to hear from everyone, but to keep that in mind.
Yes, sir. Thank you, Mr. Chair. And
did you have something
and
to
thank you to
Representative Parkinson?
Yes, sir. Thank you, Mr. Chair, and thank you. He's actually my council member, and I didn't even know who he was down there. You know, but thank you for what you're saying. You know, I don't know if I'm the only individual up here that has experienced homelessness, but you know, I was homeless 3 times before the age of 17. So I know what that feels like, right? And I want to piggyback on the council members' comments. You know, that I think we should go even a step further to find a way to make these agencies, you know, just one-stop shops, right? Where an individual can have access, or we have the, you know, personnel or people in there that can get them at least the most important and necessary resources that they need to have right there in the place where they are. And then, you know, some of the more ancillary resources that they may need access to, you know, if we can send them across the street or different places, you know, that's fine. But you know, you think about, you know, even those individuals that are coming out of incarceration who have to have driver's licenses or IDs, rather, who have to have, you know, things that if they don't have this item, they can't even access the other items. You follow me? And so I think that there is a need for us to think, you know, a little bit deeper along those lines, and you know, try to find those ways to pull all of this stuff together in one ball and be able to feed it at the same time at one time. Because once you know, you have to keep in mind the mindset of an individual that does not have a roof over their head. You know, they're in survival mode, right? And the idea is to be able to eat, and especially, and you think about it, it's even more complex and complicated when they have family members that are, you know, with them also. And so we you know, things change, and that individual, I've been there, that individual thinks completely differently than an individual that's comfortable, right? And so I just want to lay that out there. And thank you, Mr. Chair.
Thank you,
Councilman.
Mayor Waters, you're recognized.
Thank you, Mr. Chairman, and thank you all for being here today. And I noticed one statistic up there that I seen was 50% of the folks had mental health issues. And, you know, the concern that I have, and any of you can address this, is that years ago, I think in the state of Tennessee, we made this conscious effort to do away with any kind of place for these folks to go. We said they're going to be outpatient. It appears like what's happened is a lot of those are going to our jails, our local jails. We're not equipped to do mental health issues, and that's certainly a significant issue for us in Sevier County, is that they're over there trying to deal with these folks, and they don't have the expertise to deal with them. And some of these folks can't live outside some kind of structure. So a big problem that we have is folks that have these issues and don't have anywhere to go. There's nowhere for them to go. Do you all see that as a major issue in our homelessness? And if you do, have any suggestions about how we might address that issue, because 50% is a large percentage of the folks that are having issues, and there's nowhere for those folks to go.
I can tell from the panelists' expressions that every one of you want to comment, but perhaps if we got a couple of you to comment. So jump in there. The mayor is spot on, so let's hear your answer.
I'll just briefly say you are spot on. You're correct. That was my statistic that we have. One of the things we do is we partner very heavily with the Department of Mental Health and Substance Abuse Services. Beyond the list that was up on the Mr. Gobin's PowerPoint, there are lots of other programs they sponsor that we work with day in and day out to address this issue, and that's one of the things we do. We find in our street outreach, the number is probably 85 to 90% mentally ill or substance abuse services. And I agree with you completely. I've worked very heavily with our jails in our areas, and I think it's 65 to 70% of the people there are mentally ill or substance abuse. But the Department of Mental Health and Substance Abuse Services realizes that, and they are working, I don't want to speak for y'all, but they are working with our jails to help them address that issue.
Mayor, I think it's a great, I'm sorry, Mr. Chairman. Yes, sir. Mayor, it's a great question. As Vicki said, I think in recent years we've been laser focused on doing everything we can to keep people from showing up in jail with mental illness and substance use issues, from showing up at local emergency departments. We understand the strain that population places on that system. How have we tackled that? In recent years, we've worked with community providers on developing pre-arrest diversion centers, crisis stabilization units. So law enforcement, when they interface with someone who has a mental illness, they can drop them off there for treatment opposed to being incarcerated. To Mayor, your point about the recovery courts, we've really expanded the number of recovery courts across the state. Have been really thankful, thanks to the legislature, to be able to stand up additional mental health recovery courts. So for those individuals who do have mental illness that commit low-level offenses, they can be served, treated, overseen by the local mental health court there in the communities. That's been a huge support in addressing this issue. And I think Representative Parkinson mentioned, like, is there a one-stop shop? One of the things that I will say, just to brag on the community mental health center, so organizations like Alliance in Memphis, our community mental health providers are doing more and more to address the holistic needs of these individuals. So it's not just treatment, it's permanent supportive housing, it's integrated care, recognizing that so many of these individuals with who are experiencing homelessness not only have mental health issues, they have physical ailments. So our community mental health providers are providing medical services to help this population. Employment services. I had the opportunity last week to participate on a national panel on this topic with SAMHSA, and just was around national experts on this topic here. What we often don't talk about is employment. So many individuals with mental illness, serious mental illness, they want to work. Through our partnerships across the state, we fund something called individual placement supported employment, where we're working with individuals to find competitive jobs of their choosing. That's one way to get out of homelessness. And then just priorities treatment. So many people need treatment. A lot of individuals who are homeless, they don't know they need treatment. So we're doing, as Nehru said, work through our PATH program, street outreach, using peers, people that have lived experience themselves with homelessness. That's one way to build trust among these individuals. So is there more work to be done to address the issue you raise? Absolutely. And we're committed to continue to try to address those issues the best we can.
If I may, I would like to offer a comment here. I appreciate your answers, but when I couldn't agree more with Mayor Waters that we need bricks and mortar. You ask any local law enforcement and they'll tell you when they picked up somebody on Saturday night or Monday morning, whenever, who have obvious mental health problems, there's no place to take them. So they end up back on the street or in the local county jail. And where most county jails don't have the facilities or the trained people to deal with people who are mentally ill. So the response given to me when I raised the issue about why we don't have bricks and mortar facilities anymore, well, we contract it out now. Are the contracted agencies there? Are they meeting the need? Would somebody jump in on that for me, please? That's the answer I was given. We contract these services out. Well, mental health, we'll just stay with you then. We're contracting these services out. Are they an adequate replacement for bricks and mortar in providing services?
Chairman, I think it's a great question. One of the things I'll say is that we know what works. We've got to do more of it. So,
what works? Contracted services or bricks and mortar?
Well, we've been doing both. So one of the things that we've done in recent years is actually establish new crisis stabilization units,
right.
crisis walk-in centers from the ground up. One recent example is there in Memphis. It's been a huge resource for that community. We're also focusing on rural areas of the state. Dyer County, through Pathways, is opening a crisis walk-in center. So we're doing everything we can to give local law enforcement an alternative from having to place someone in jail. The other thing that we're doing, as Nehru referenced, is building out housing. I think many of these individuals, obviously they need housing, they need treatment, and they need it concurrently. And we've done a lot of work in building out new housing options for individuals. Thanks to the legislature, we're funded just recently to build out reentry housing for people coming out of the criminal justice system with mental illness, so they have a safe, stable place to live. So,
but excuse me, but we're talking here about people. I think Mayor Waters was addressing people who may be picked up by law enforcement, where maybe housing isn't the primary issue. It's getting these people services, some treatment, and they're not getting it because there's no bricks and mortar facility to take them to anymore, which is really I have 9 very rural counties, and the law enforcement in those 9 counties are unanimous in their concern about this issue. Mayor Brooks.
Working today. There we are. You'd think I would know how to work the button. I'm going to stick also with our guest from mental health. The city of Cleveland, we have actually begun the process of a new bricks and mortar facility. We are partnering with our county. We are partnering with some federal funding that Congressman Fleischman's office has sent our way to Bradley County. So my question is, in this entire conversation, I'm digging through the handouts to find out which TN 502, 507, which TN is Cleveland, because what we have come to the conclusion that bricks and mortar is going to be the solution for Bradley County in the situation that we have. Are there agencies that we need to be in touch with? Because right now we're just going to kind of do it on our own. And my question is, could you forward to this TACIR or to me agencies that we need to be partnering with at either the state or additional federal levels? Because we're going forward whether we can find assistance or not, because it's just not out there. So I'm very grateful the City Council said part of the recent tax increase for our citizens is a transitional housing facility that the county says, we're so into this, we're going to partner with you. But right now, that's the only 2 partners we have. Thank you, Mr. Chairman.
And thank you, members of the panel and members of the body, for your questions. It's been a good discussion. It's one that could go on longer, but we do have other agenda items. There's no objection. We will close the debate on this and move to the next tab, which would be tab 4. And the panelists, thank you very much. You've offered some very relevant and obviously thoughtful remarks that were helpful to us and stimulated our thinking and our discussion. So thank each of you very much.
Thank you, Mr. Chairman. So yes, as just noted, this is tab 4 on DA staffing and municipal courts of concurrent jurisdiction, with the attached commission report being submitted for your approval. This report was prepared in response to Senate Bill 2054 by Senator Jackson, and House Bill 2205 by Representative Barrett in the 113th General Assembly, which would have required cities with municipal courts of concurrent jurisdiction to fund at least one assistant district attorney or ADA position for their district attorney and grant the DA sole discretion to determine whether the city needed to fund additional DA staff. The bill passed in the House but was referred to the Commission for study by the Senate Finance, Ways, and Means Committee. We presented a draft report for your review and comment at the January 2025 meeting. The final report's first recommendation is unchanged from the draft. Rather than the bill as proposed, the report recommends that the state undertake a weighted caseload study as soon as is feasible to establish the staffing needs of district attorneys based on all the courts they serve, including municipal courts with concurrent jurisdiction. The second recommendation has been modified slightly in light of Public Chapter 369 of this year, which authorizes counties to adopt and levy a new court cost on defendants, with revenue from that cost put at the sole discretion of the District Attorney General. The final report now recommends that to assist with DA staffing needs prior to the completion of a weighted caseload study, each city with a municipal court of concurrent jurisdiction that does not already have an existing funding arrangement with its DA, or that does not have to collect the new court cost under Public Chapter 369, Acts of 2025, consider negotiating a per diem payment for DA staff. And so with that, I'm happy to take any questions you may have, but otherwise would ask for your approval of the report.
If there's no objection, we'll go ahead and get I believe this report will call for, it is the final report, we'll call for approval. Chair will move the approval. There's no objection and entertain a second. There is a second. Thank you, ma'am. That's the county clerk. Now, do we have questions? Comments? My goodness. There's been a motion, second for all right. There are no comments, and we will take it to a vote. Those in favor of the motion to approve the final report, say aye. Opposed, nay. Carries. Thank you.
Thank you.
All right. Our next item would be item tab 5, public. The final report on real estate fraud. Mr. Morio, there, if you will. You're recognized, sir.
Thank you, Mr. Chairman, and good morning, Commissioners. I'm happy to present the Commission's report on protecting Tennesseans from real estate fraud for your final approval. It was prepared in response to Public Chapter 941, Acts of 2024, and describes the prevalence of real estate fraud in Tennessee, different schemes used to perpetrate fraud, methods used by other states to combat fraud, and best practices for local government officials. The draft report was presented for review and comment at the June Commission meeting, and the Commission's 3 recommendations have not been changed from those presented in the draft. Because notaries public have responsibilities that put them on the front lines of defense for preventing fraud, the Commission's first recommendation, found on page 2, is that Tennessee require in-person notaries to complete an instructional course on notary laws, ethical requirements, and best notarial practices, including specific guidance about recognizing and preventing fraud, both when applying first to become a notary and when renewing a commission, something that Tennessee will already require for remote online notaries beginning in January 2026. Some additional information about notary requirements and training has been added to the final report. Page 9 has more details about requirements to become a notary in Tennessee. On page 22, we added a new table to categorize notary training and exam requirements for all 50 states. Responding to a question asked during the draft presentation, we explain on page 23 how states deal with integrating training requirements into their notary application processes. And then page 24 has a new table with updated information about bond requirements for notaries in all 50 states. Moving on to the second recommendation. In Tennessee, when notary is personally acquainted with an individual signing documents in person, the notary can accept that signature's identity without providing any proof. If they're not personally acquainted, the notary is supposed to obtain satisfactory evidence that the person who is who they claim to be, either by checking form of ID or through credible witness who is personally acquainted with the notary. But for in-person notaries, Tennessee does not require the notary to record that identifying information or keep it in a journal unless a fee is charged. And so the Commission's second recommendation, found on page 3, is for Tennessee to require notaries to verify the identity of all individual signers and witnesses by means of government-issued credentials and maintain a journal of all notarizations performed in person and, as is already required of online notaries, to keep those journals for at least 5 years. The recommendation also specifies what specific information must be included in journal records, including describing the evidence used to identify any signers or witnesses. Some additional information about the importance of the notary's journal can be seen on page 14. There, in response to a question about issues with forged notary stamps during the draft presentation, we noted that detailed journal records can help defend notaries against accusations of fraud if a notary's stamp is forged or stolen. But it also is recommended that notaries protect themselves by carrying errors and omissions insurance. Pages 25 and 26, there's some added detail about verifying identities in notary journals in Tennessee, and new tables on pages 27 and 28 to show how journal requirements, what journal requirements are for states that have them. Lots of page flipping, I know. So returning to page 4, the recommendations, because a process for registers of deeds to review or refuse to record suspicious documents, as several other states have authorized, could help prevent fraudulent deeds from being recorded and stop those who attempt to commit real estate fraud from completing and profiting from fraudulent transactions. The Commission's third and final recommendation is that the General Assembly authorize counties to establish a fraud referral and review process, possibly similar to the process authorized for counties in Illinois, for real estate documents that county registers of deeds have reasons to suspect are fraudulent. Any other areas where information has been added or revised significantly from the draft report are highlighted in your materials and in the docket book online. I'm happy to take any questions at this time, as well as ask for your approval on this final report. Thank you.
Before we start the discussion, the chair would entertain a motion to approve the vote. This is the final report. Is there a second? Can I get a second? There is a second. Now, do we have questions or debate? Questions from the members? Yes. Representative Parkinson.
Thank you, Mr. Chair. I'm not there yet on the approval of this, and let me tell you why. First of all, I think you guys did a wonderful job, but I don't understand why we hadn't made a recommendation for Register of Deeds offices to require an ID when someone is doing a quitclaim deed in their office.
So thank you for the question. We talked about on page 11, previous legislation, Public Chapter 941, Acts of 2024, that would have required registers to ask filers for identification. We talked about how there were some issues when that legislation had just gone through. So some of the concern about issues with that being recently discussed were something that we considered. I would note that for anyone wanting to further pursue that, page 34, and I think this goes along with that there are a couple of states where that's being sort of tested out, and I think maybe giving that some time to see what might happen. Lee County, Florida, mentioned on page 34, seems to have something that's similar to that. And they're supposed to be coming out with a report on that pilot program this year. So I think giving that some time is something that might be of interest.
Thank you. And I was kind of scanning over this part on page 11, and I see the discussion, but I don't see where there was an issue with requiring an ID at the Register of Deeds office if somebody comes in and they're making a quitclaim transfer and just having that ID just recorded, I guess, along with that quitclaim. Because here's what's happening: anyone almost can create a quitclaim document and have it notarized either falsely or not, and taken into a Register of Deeds office, and then that property is literally stolen from the individuals or the family that own that property, and it makes it incredibly hard to track who actually came in and stole that property if there's no ID, associated or captured in that moment that quitclaim deed is registered with the Register of Deeds. And so, but looking at this paragraph on page 11, I see that you guys did discuss it, but I don't see where there was any opposition to it or any pushback. Or I think that when this legislation was ran, I think that the Registers Association was confused as to what the legislation was actually saying. In saying that a person has to present an ID, you make a copy of that ID and you keep that ID for associated with that transfer, and not anything elaborate where you have to open up create a new computer system or something like that. And so I would ask that we hold up on approving this and get that issue addressed, because you're talking about really the and it's pervasive, the theft of generational wealth for families, and properties that may have been passed on down to their families, and it's a big issue.
I'm going to let Mr. Peach
if I may,
be recognized. I'm sorry.
If I wanted to just respond to some of the
You
rest
should.
of Representative Parkinson's questions. The concerns and stuff that we acknowledged in the report came out of interviews that were done in 2024. I think when that legislation was going through, because this report had begun a little while ago.
Yes, sir.
And so that is where those came from. And again, like you said, that was a while back. One of the things that I think would need to be worked out through trying to do something like that is if someone is able to come to falsify a quitclaim deed and present that, they're probably just as good as coming with a stolen identity and some way of verifying that the person, the identification they're presenting to you at the Register of Deeds is a valid ID and is who that says it is something I think that would need to be figured out. And that's where I think looking at how some of these other states are testing out, implementing things like this in a little more detail than maybe had been done in the past is something to look for going forward.
Yes, sir. And
Ms. Parkinson, you're recognized.
Oh,
And
sorry,
we
Mr.
have
Chair.
two people waiting for the
yes,
floor.
sir. I'm sorry, Mr. Chair. And I understand that. But right now, they don't have to present anything, so there's no barrier at all for that. And and if there's even in the language of just making a recommendation that Register of Deeds require an ID is not it's not necessarily telling them getting into the weeds of how they do it or what they do, but just require an ID. And so this body can make that a recommendation as one of the recommendations, just as we made these other items recommendations also. And one last recommendation I think that we might have missed also is making the penalties a little bit stiffer for those notaries that are part of this scheme in creating these false quitclaims that people are going in and using and stealing people's property. So thank you, Mr. Chair.
Parkinson. Mr. Peach, you're recognized, sir, and then Mayor Frank, and then Mayor Brown.
Yes, and I'll keep it brief. One, you always do a great report, and I appreciate it. But I want to echo that Representative Parkinson is 100% on track with, we just this past year have put in place, or the federal government has, for title companies have to find out where all the money's coming from. We have all of these requirements, but with the Register of Deeds, there's just not that any level hardly of. Matter of fact, they'll just tell you, well, we have to accept it. We have to accept it. And so, in my experience, I have not seen a rash of notaries approving stuff that they shouldn't, because usually these people that are filing liens against your property, they want to put their own name down for sure, because that's how they get their money. So, anyway, I agree with Representative Parkinson.
Thank you. Mayor Frank, you're recognized.
Yes, thank you, Mr. Mario. I appreciate the recommendations. I just wanted to ask a little bit of follow-up on the notary, that individual themselves. I like that you're suggesting training. How does it work in the state of Tennessee? I would assume, I mean, we're talking about proof of identification on to prevent fraud on one side, but a bad notary could also be part of any potential fraud. So if you could explain a little bit about that process. And I was looking in the report, I know you noted some of the states that require background checks, but I couldn't remember. It seems like the number was 13 or something like that. 13 states require a background check for the notary themselves. Is there some more work that we should do perhaps in ensuring that reputable people become notaries, or is it something where anyone and everyone can become a notary? And I'm getting that because I think one of our panelists had mentioned that was a way to prevent fraud, was to ensure that they were qualified notaries.
Thank you, Mayor. Yeah, and you're correct that page 24, that 13 states requiring criminal background checks. No, it is not required in Tennessee. The applicant is signing an affidavit saying, I do meet the qualifications. I do not. There are requirements that say if you have certain criminal things on your record, then you're not eligible to become a notary. But you're basically saying, I swear I'm not a criminal. And to the extent of how that is verified, I think would be up to, the county commissions that are approving people that are coming in for applications to become a notary. It is something that, it seemed less common, but does have potential, I think.
So is there something that our county commissions should be looking at? Like, I mean, should they be reviewing individual applications, for instance? And I think about this in terms of our seniors, because a lot of seniors there's an incentive to become a notary and travel and go to a senior citizen's home, and they're charging a fee. But yet the county is putting this person in a position of, we've given you our stamp of approval, you're an official, if you will, because of that approval. And it just seems like they're, I don't know if there's any guidance to help us do a better job of actually approving who is a notary.
Thank you. That isn't something that I remember coming across as far as, and I think I would defer, yourself and some of the other county members, of when you've been asked to approve commissions for notaries public in your county legislative bodies. Do you recall it just being a consent agenda item and moving on, or was anybody taking a look at them? And if not, is there any reason, are you actually, could you do that, or is it something that would need some sort of additional legislative authority? I don't know at this time. It wasn't something that came up.
Mayor Brown, you're recognized.
Thank you. Similar line of concerns. Well, I do wonder about the competency of some of the notaries that do become notaries. I really worry about the impersonation of notaries, because it's really easy to get a notary stamp from anywhere in this world and act as one. And so I wish there were some verification process through which you could, verify that person whose name is on the rotary whose name is on the deed is actually the notary who actually, stamped that thing. Haven't recently completed another quitclaim deed for property in another state. It was a little terrifying for me to literally write up a quitclaim deed myself, sign it, had my brother sign it. We got it notarized, and I mailed it to the Register of Deeds in another state. Now, the thing that I did appreciate on the other side is that state is required to notify the property owner, and they have to notify them at the address that is given on the quitclaim deed and whatever the last address of record was on the original deed. And so I felt like that was some kind of insurance, and so I did like that there was some notification required. And I realized that you can get the alert email, but it feels pretty heavy that somebody can just go in and do that nefariously and that property owner not have any idea until some point in the future.
Yeah, and I think that the balance between requiring a notification for anything that comes up overwhelming the system versus, the importance of it catching things that somebody didn't actually file themselves. I think kind of going forward, looking at more and more counties, more and more registers that are choosing to do that, to have the voluntary services, sort of see how those things are working out, may lead to that becoming more common. I did want to page 9, 9, 8, 9. We did try to look into the issue of trying to get stamps, and at least there were a few states that specifically require that you prove you have a certificate as a notary. But the online retail, everyone that I went to look up, search for buy a notary stamp, all said they require it to be part of the transaction to buy it. I'm sure you can get illicit things everywhere, but it is something that is at least being somewhat addressed through the research we did.
I recognize Vice Chairman Brooks for a purpose of making a motion.
Thank you, Mr. Chairman. I'm going to agree with my colleagues, the esteemed Representative Parkinson, and I'm just not sure that we're quite ready for a final vote on this today. I'm going to make a recommendation or make a motion that we defer this 1 month. I know there's a January deadline to next month's meeting so that we can fine-tune. And a follow-up on that is a question. You mentioned Public Chapter 941 quite a few times in this report. Is that current law? Because Public Chapter 2024 to me sounds like that's currently on the books and is law. But the way you've worded at least 4 different times, Public Chapter 941 could have, would have, should have, it's worded in a way that 941, has it been repealed?
There was, the way it's referred to in the report, Mr. Mayor, is that original versions of that legislation had some things in them that did not make it through to what was finally approved as the public chapter. So I think maybe clearing that up, or at least in my presentation wasn't clear that there were different versions, that was the stuff that was in the original version that didn't make it to what was enacted.
Well, I don't have a Graceland in Bradley County like Antonio does, but that was almost stolen by this exact problem. But I do have a family member that was a victim. So I'm very familiar with this process and the sort of loopholes, as Mayor Brown was talking about, that you can do through the mail, online. So I'm going to make that motion that we defer it 1 month. If that's a proper motion, Mr. Chairman.
It is a proper motion. The chair will second. With the understanding that we do have a January deadline on this, but I believe since much of the work is already done, you'll be able to address the concerns that were expressed here, and we can make a final decision next month. Is there we need a vote on this, I believe. I'm going to defer to Director Clifford.
On the motion, I would like to clarify, though, that we don't have a meeting scheduled for next month. And it may seem like we're meeting every month currently because of our subcommittee meeting.
Every week, it feels like
But on our normal meeting schedule, we would likely not be meeting again until early December, which is still works. But I would like to change the motion so that we don't meet next month. Thank you.
I will change that motion to next calendar or next meeting, which would be December.
No objection to the change, then I'll second the amended motion. That's done now. Thank you. I appreciate that.
Thank you, Dr. Lippert. I would like to say, Dr. Morio, great work, and I love the tie. Go Doors.
Anchor down. Thank you all, and I'll get in touch with each of you who have concerns about the specific the ID register, ID requirement stuff, and see what we can get hammered out here quickly. Thank you all.
I'm sure you have, but I would encourage you. I know when we were talking about Representative Parkinson's concern about people who come in with no ID and give you a deed to the courthouse quickly. Or Graceland, and I want to make sure there were some comments made to me that there might be some opposition to that from the registers of deeds. Make sure that our registers of deeds have some input in this.
Absolutely. Yeah. And I think tying it in, the third recommendation we do have, where giving registers a process to flag fraud, things that don't look right. These two things should, I think, work together, and I think that's something we can do.
We haven't set the date for the next meeting, but it's almost always early December.
All right. All right. Okay. We'll let it stand the December meeting. Now, objection, those in favor say aye. Aye. Opposed, nay. Carries. Thank you. The next item.
Thank you. As Chairman Yeager mentioned, I'll be presenting our report, Reducing Tennessee's Evidence Backlog by Expanding Forensic Crime Lab Capacity, for your final approval. In response to ongoing concerns about evidence backlogs and turnaround times, Senate Bill 2877 by Senator Kyle and House Bill 2961 by Representative Hardaway were introduced in the 113th General Assembly. These bills aim to direct the Commission to study the feasibility of establishing a crime lab in Shelby County. The bill passed in the Senate but did not advance in the House. And at the May 2024 Commission meeting, Representative Williams requested that the Commission undertake a broader study to examine the feasibility and need for establishing additional crime labs throughout the state, evaluating the existing labs' capacity to process evidence efficiently, and consider where new labs could be located to best utilize state resources. This report is the result of that request. In response to requests by members at the June 2025 meeting, when the draft report was presented, Commission staff added the following information to the report, which you may find on the pages mentioned, highlighted in yellow. To address the state's digital forensic needs, additional information was added on pages 4, 5, 30, and 31. TBI anticipates improved turnaround times for digital forensics once newly hired staff complete training, and continues to evaluate staffing and facility needs for this area of testing. Examples of crime lab cost estimates, along with a summary of the cost projections from TBI's real estate strategic plan, were added on pages 3, 28, 29, and 30. Table 4 on page 30 summarizes the estimated cost of TBI's planned expansions. Appendix F, beginning on page 67, provides examples of construction, expansion, and renovation cost for crime labs. And Appendix H, beginning on page 75, summarizes cost estimates for alternatives to building new labs. Based on the available information, the planned Jackson and Knoxville TBI lab projects combined could cost between $44 million and $66 million. The estimated cost of the TBI Nashville and Chattanooga projects is still unclear at this time. We are also aware of a budget request that was made for a larger TBI Knoxville headquarters at a greater cost, but that budget request has not been approved. Moving along, Figure 7 on page 31 explains that TBI's labs are primarily funded through annual state appropriations, with some additional funding provided by grants, similar to how other labs are funded nationwide. and staff provided more historical context on long-term crime trends by adding evidence request and turnaround time data dating back to fiscal year 2020 in Figure 4 on page 25 and Figures 5 and 6 on page 27. And finally, additional information on outsourcing evidence testing was added on page 26. One of the draft recommendations presented at the June 2025 meeting has since been implemented. The draft report recommended that TBI and the City of Memphis enter into an agreement for a firearms analyst in the Jackson lab dedicated solely to Memphis cases. Since then, TBI and Memphis have signed an agreement to assign 2 forensic scientists, one in DNA and one in firearms, who will work solely on Memphis cases. These positions will be funded by the City of Memphis, and TBI plans to hire 2 additional scientists for the Jackson lab. The final report's other recommendations remain unchanged. Without addressing the constraint of limited lab space, the state's effort to improve forensic capacity and evidence processing and public safety, Without addressing the constraint of limited lab space, the state's effort to improve forensic evidence processing and public safety will be hindered. The Commission recommends increasing crime lab capacity in each Grand Division in line with TBI's 2024 Real Estate Strategic Plan by expanding the Nashville and Jackson labs, replacing the Knoxville lab with a larger facility that includes firearm testing, and adding a smaller focus lab in Chattanooga for drug evidence and toxicology. Expansions in Nashville should especially target the most overburdened disciplines such as forensic chemistry and toxicology. Finally, while the state undertakes the long-term projects of expansion, there are interim practices that can reduce backlogs and expedite results. The Commission recommends that TBI continue to pursue external process improvement methods, that the General Assembly amend DNA laws to allow rapid DNA use at booking stations, and that the state support research sharing partnerships that train and equip local law enforcement. That concludes my presentation. I'm happy to take any questions, and I request approval of this report.
To get it on the floor of the chair, we'll move approval. To get it on the floor of the chair, we'll move approval. Is there a second? Mr. Peach, thank you. There is a second. Now, questions, comments, debate? Members? Senator Yarbrough?
I just want to circle back to one thing. I believe that we're already out of capacity in the Jackson lab, and we finished construction of that lab in 2021. I mean, that part's given me just pause in terms of, during that entire period, the legislature was trying to expand capacity. Like, we were intending to do this, but we're over capacity, 4 years after completion. And I'm curious if it's should be in this report or if it should be a separate report, Mr. Chairman, but it seems like there has to be some way that we're actually thinking about the kind of long-term planning when we're approving projects like this. It's at least intuitively, it would have been a far less significant expenditure for the state to build a larger project that was finished in 2021, or at least have the capacity to finish out the lab spaces within a larger footprint in 2021 than to now undertake like an entirely new process, 4 years after completion. And I think it's just as being I'm sure that a lot of legislators who we thought we were sending more capacity into this program, and it turns out that we weren't sending as much capacity as we thought we were. And I just want to try to understand whether we should address that in this report or whether it is a sort of separate issue when it comes to the way that we're acquiring properties. And I don't know if I'm directing that to you or to Director Lippert, but I just want to.
Do you have any comments you would like to make to that, ma'am?
Yes, thank you. TBI in their real estate strategic plan that they did in 2024 is looking forward several years. maybe 10 to 20, and what the demand, might be based on population growth and other factors. I think the demand, from what they did in the past, the demand grew more than they anticipated, and they had to hire staff more quickly than anticipated, and that's given them the need for more space.
Thank you. Thank you, Ms. Thorne. Other questions?
Can I follow up, Mr. Chairman?
Chairman Brooks.
Thank you, Mr. Chairman. Senator, I'll address this to Senator. Great report, Ms. Thorne. Thank you. I think it's like our local municipality. We're being asked to build 2 new schools at the very same time that we're expanding the schools that just got finished. I'm not sure that there's ever going to be a place where we build enough capacity in these crime labs. Unfortunately, it is a growing problem all across this state. And I agree. I saw the same number and I thought, well, good golly, we just expanded Jackson and got all the capacity out west, and now we need even more. My bigger question is the General Assembly prepared for the funding that it's going to require to make these recommendations possible? I look to my colleagues to say, okay, this is a great recommendation, but it's going to be expensive, sadly.
Senator.
Well, and I agree with that, especially to the extent that, what the report says, and I agree that it is a very good report, is that the ability to do this testing is a function of both the personnel that's required to do the work and the physical capacity in these facilities. And I think that but I don't think that we can make appropriations decisions thinking that we can just move one of those things up without having to at the same time start thinking through how we're moving the other up. I think it leads to us undercounting the cost of making certain changes. And I think this is just, for those of us who are working the appropriations process, I just think we need to recognize that sometimes we're making a decision to throw people at something, but it's usually rare that just that cost will be, there are other costs that come along with that we need to actually factor into our decision making.
All right. Thank you. Well taken. Are there other comments or questions for the? Well, there being none, then we may be ready for a vote. I believe the matter is before us. Mm-hmm. Those in favor of the motion say aye. Aye. Opposed, nay. Carries. Thank you. Motion carries. And now I believe we're going to go to tab 8. Mr. Fox, or excuse me, Ms. Fox, pardon me. You're recognized.
Thank you, Mr. Chairman. Good afternoon, Commission members. Public Chapter 102 acts of, can you guys hear me? Sorry. Public Chapter 102 Acts of 2025 directs Commission staff to study the economic effect of the cosmetology and barbering professions in Tennessee. This includes revenue generated by the professions in retail sales, along with training and education opportunities and any potential barriers to entry into the industry. We are continuing to collect and analyze data and interview stakeholders this fall for the study. We will present the draft report at the January 2026 meeting and the final report at the spring 2026 meeting. We have found that the cosmetology and barbering industry is growing both nationally and in Tennessee. Nationally, overall projected employment is expected to increase 5% between 2024 and 2034, outpacing the average 3% growth rate for total employment. In 2023, the Tennessee Department of Labor and Workforce Development classified cosmetologists and barbers as in-demand occupations. The number of active cosmetology and barbering licenses of all types issued by the State Board of Cosmetology and Barber Examiners, the regulatory board overseeing all individuals, shops, and schools in the industry, have consistently increased over the last 10 years. Table 1 on page 3 of the memo has information on all licensing types. Tax revenue from beauty supply shops, barber shops, beauty and nail salons, and cosmetology and barber schools has been increasing. This includes franchise, excise, and business tax revenue, along with state and local sales tax on products sold in salons like shampoo and conditioner. Barbering and cosmetology services are not subject to sales tax. See Table Number 2 for a breakdown of tax revenue by taxpayer type. The Tennessee Board of Cosmetology and Barber Examiners is responsible for regulating the cosmetology and barbering professions to protect consumer health, safety, and welfare. All individuals, shops, and schools operating in the state are required to have a license, including cosmetologists, estheticians, manicurists, natural hairstylists, hair braiders, eyelash specialists, master barbers, barber technicians, cosmetology and barber instructors, and cosmetology and barber shops in schools. Requirements to obtaining a license vary depending on the type of license. The memo briefly describes some of the requirements on pages 6 and 7, and Table 3 shows some of the fees charged for licenses. Based on a preliminary review of other states and interviews with stakeholders, Tennessee's regulation of the industry is similar to most other states. For example, the 1,500-hour requirement for a cosmetology or master barber license aligns with about half of other states. I would like to open the floor to questions and comments. Thank you.
We will not be voting on this. This is not the final report, but we will take questions and comments. Representative Parkinson, and then
thank you.
You have the floor. You're recognized, sir.
Thank you, Mr. Chair, and thank you for your hard work on this. The reason that I asked for this study is because I wanted our state to understand the economic impact that the barbering and cosmetology industry provides to our state. I think it had been gone unnoticed for a very, very long time, probably up until now. And even myself, who I do most of the barbering and cosmetology legislation in the state, even myself looking at these numbers, finally formally quantified, I'm even mind blown at the numbers that are presented here. I also want to thank my colleagues too for the legislation and supporting the legislation that we run in barbering and cosmetology, because if you look at how our industry is growing in licensed individuals, in the different disciplines, this all comes from us being cognizant and supportive of shifting some of these ideas, right? And I'll give you an example of that. Looking, prior to 2013, every discipline had to go through a full cosmetology school. And in 2013, we broke it up to allow for specialty schools to be created and, for specific disciplines. And if you look at, let's go to eyelash specialist. This is the last one we passed, I think last year. Was it last year, 2024? I think it was last year, 2024. And since then, we've already got 84 licensed individuals from that in 2024. And for the men up here that don't really get their lashes done, these ladies, I'm sure they understand what I'm talking about. But that is a $1 billion plus industry in itself, $1 billion plus, and and so I just want to applaud the Tennessee legislature and everyone involved and TACIR and you specifically and your team for doing such a wonderful job in pulling these numbers. And the last thing I want to say too is this, we although these you look at these tax numbers, these are good, but we still leave a lot of money on the table, when it comes to this industry that we're not collecting. So I think there's a great opportunity, and it also speaks to that we need to invest more in this industry, because, our state, believe it or not, is one of the leaders in the barbering and cosmetology industry. So I want to thank you for that. Thank you for everything you've done. I really appreciate it.
Thank you, Representative. Are there other questions or comments about the report today? No motion is required, so we think there being no more questions, and we will close the discussion on this for today. Thank you very much, Ms. Fox. And we had, despite our best efforts to try to move the panel discussion up before lunch so we could leave earlier, we were not able to do that because I think one of the or more of the panelists already had commitments and couldn't change the time. So we're going to get an early lunch today, and we'll be back in time promptly at 1 for the panel discussion. Unless there's objection, we'll recess. I guess that would be the appropriate thing, to recess until 1. And I appreciate the support we received, and would encourage staff to, when we're in these situations where we only have one program after lunch, that we try to maybe consider working through lunch than coming back. But we just weren't able to make that work this time because of prior commitment. We stand in recess till 1 o'clock. Ladies and gentlemen, welcome back to TACIR. We will go ahead and resume our agenda for the day. I believe that we are on the last item of the day, except for other business, and that item is tab 7, a panel discussion that has been put together by Hannah Newcomb. Ms. Newcomb, will you come up, and if you'll bring your panelists up here and get them seated, we'll get started. Oh, okay, I'm sorry. Good. Okay. Good. I thought you guys were all on the front row, but well, you are, so to speak. So good. If we can, then we'll start over here to my left, and make sure that you speak clearly into the mic. And the mic is not working unless you have it's red. And when you're through speaking, turn yourself off so someone else can speak. But if we'll start over here, introduce yourself, and then. All right. And then we'll let Hannah, do you want to do the introductory remarks now or before we introduce the panelists? Or
I can go ahead. I have a little update on it.
All right. Well, you'll have more time, ladies and gentlemen, to savor the words of your introductions. So please get us started, Hannah.
Okay, great. Well, thank you, Chairman, and good afternoon, Commissioners. So we have tab 7. This is our study on housing juvenile offenders. After the memo in your docket book, there's materials that the panelists provided, so they'll be referring to them throughout, and you can look, on the copy in front of you. So Public Chapter 418, Acts of 2025, directs the Commission to study the current availability of housing, detention, and treatment facilities across the state for juveniles who have been adjudicated delinquent and committed to the Department of Children's Services, or who have been detained by the juvenile court prior to an adjudicatory hearing, and whether there is need for additional capacity. Facilities for housing and treating juvenile offenders are important components of Tennessee's juvenile justice system. But if available capacity doesn't meet the need for placements, it could present risks to the welfare of youth in custody and the general public. Youth detained prior to their adjudicatory hearing are placed in juvenile detention centers, which in Tennessee are operated by either local governments, including juvenile courts, or private entities. These facilities are intended for short-term placements, typically less than 30 days. There are at least 3 juvenile detention centers in each Grand Division of the state, but not every county has its own facility. In counties without their own juvenile detention centers, judges and sheriffs report having to transport youth across county lines, and sometimes even across the state, to find an available pre-adjudication detention bed. Youth who have been adjudicated delinquent may, at the discretion of the juvenile judge, be committed to DCS custody. Once that occurs, DCS determines where to place the child based on the severity of the offense and the child's behavioral, medical, or other treatment needs. DCS has a network of providers, including one state-operated secure residential facility that it uses to house and treat children in its custody. Housing and treatment options for juvenile offenders in DCS custody range from foster homes to secure residential facilities. The latter are generally classified as either staff secure or hardware secure based on their operations. Juvenile offenders placed in hardware secure facilities are typically those who have committed more serious offenses and require more security. There are times when DCS will place children in its custody in juvenile detention centers or other temporary placements, including assessment centers, until it can find an open bed for long-term placement in an appropriate, secure facility. For today's panel, you will hear from 6 stakeholders about the state of housing, detention, and treatment capacity for juveniles, both pre- and post-adjudication in Tennessee. And we have here today with us Robert Filial, the juvenile court judge for Hamilton County, Andrew Brigham, the general sessions court judge for Stewart County, Sheila Calloway, the juvenile court judge for Davidson County, Christy Little, the general sessions court judge for Madison County, Jim Lehman, the executive director of legislation for the Tennessee Department of Children's Services, and Matt Yancey, the deputy commissioner of behavioral health community programs for the Tennessee Department of Mental Health and Substance Abuse Services. Lastly, staff invited Tennessee Voices, a nonprofit which provides services to juvenile justice-involved youth and their families, to participate on the panel, but representatives for the organization were unable to attend because of a scheduling conflict. Staff plan to present a draft report for review and comment at the Commission's next meeting. And without anything further, the panelists can introduce themselves.
I believe that we have, someone has spoken to you about the time limitations on your individual presentation. We appreciate your cooperation and look forward to hearing from you, Judge.
Thank you, Chairman Yeager, and thank you all, and welcome to our world. We're glad you're lifting the sheet a little bit and taking a look at in our world and what we do, and we thank this whole panel, this work, and especially Hannah and her team for work in this process so far. I am Rob Filial. I'm the judge of the Hamilton County Juvenile Court in Chattanooga. I'm also the chair of the Tennessee Commission of Children and Youth. And I'm the president, and more importantly for today, I'm the president of the Tennessee Council of Juvenile and Family Court Judges, and we're here representing that body in part today. Our conference today is represented by our immediate past president to my left, Judge Eddie Brigham of Stewart County, our vice president, Judge Sheila Calloway of Davidson County, our longtime executive committee member Judge Christy Little of Madison County. They're each going to be, of course, speaking to you. This issue, though, I want you to know is very important to every member of our conference. Many who have been in the trenches for years and have expressed their struggles in finding placements for juveniles from their respective counties. So just be assured that we're four of many in our conference position is that there is certainly a need for additional capacity across the state for juvenile housing. A lot of judges, more than us, but a lot of judges have met with these working groups during these discussions, during your work, and have shared both data, hard data, and a lot of anecdotal evidence of real-world application of the laws at Tennessee that some of you all pass that necessitate or require detention of juveniles and the struggles that are experienced in trying to do that. And we provided some of that data as an exhibit, and I hope you all have that. The data for juvenile courts is not perfect. It's better than I'd say it's better than it's probably ever been, and it's gotten better in the last few years. We're looking at apples and oranges now instead of mixing the fruits, and so we're getting better there, and thanks to a lot of help from the legislator to help us get there. Again, we welcome and thank you for this impartial, research-based work that we believe will confirm the dire need for juvenile housing. In just a moment, Judge Brigham is going to talk about the nuts and bolts of detention of juveniles and some trends that we're seeing. Judge Calloway is going to talk about what we can and can't do regarding alternatives to detention that we all look for. We all look for alternatives to having to lock a child up wherever feasible and safe for the youth and for the community. And then Judge Little is going to talk about the needs generally that apply to the whole state and about the western part of the state, particularly where she's gathered letters of testimony of judges throughout that part of the state citing their needs and experiences. What you'll see and hear is that some of our counties have access to a county-run local detention center, but most do not, and then have to struggle to find and pay for and transport to and from other counties. And I believe you'll find that most all of those detention units are old and outdated, including the one where after an earthquake it was reported there were minor injuries. Okay, I'll stop. With that, I'll pass it on down to Judge Brigham.
Thank you, Judge Filial. My name is Andy Brigham. I'm the General Sessions and Juvenile Court Judge in Stewart County, a very small county. Our population is between 14 and 15,000. I've been the judge there for almost 23 years. detention overview. Most of the time what we're talking about when we're talking about detention is pre-adjudication. You might think of that as bail in the adult world. Two primary considerations, risk of flight and public safety. The bail setting magistrate or the juvenile court judge must take that into account when deciding whether or not to detain a child. But most of our detention needs are for pre-adjudication. When something happens and we don't know what the situation is and we need to have a cooling off period, very much like domestic violence, 12-hour and 24-hour holds on the adult side, sometimes we need a place to put children until we determine whether or not they truly pose a risk. So we're talking about pre-adjudication primarily. That is a county expense. My county has contracts with 6 juvenile detention centers, and they're all about $250 a day. My county's budget for detention is $5,000, so we can run through that, pretty quickly. I had a murder suspect detained for about 8 months, and well, you can imagine how much money that was. I had to go before the county commission and ask for more money. They gave it, but that's kind of what we're looking at. Also, there's post-adjudication detention needs. The law does allow a juvenile court judge to detain a child after adjudication. That is rarely done in my experience. Most of the post-adjudication detentions are done through DCS. We have a gate system here in juvenile court. We are the gatekeepers. We commit children to DCS custody, then it's up to them to decide where to place the child. And so that's the bulk of post-adjudication detention decisions are made by DCS, and I think that will become apparent as we go forward. There is a hybrid. If a child is on probation and commits a certain offense, then the judge does have the authority to detain that child. So that's kind of a post-adjudication, pre-adjudication hybrid situation, and that happens fairly often. The detained youth is entitled to a detention hearing within 72 hours. There's an additional procedural safeguard built into that hearing, not present in the adult system, and that is we have to find probable cause that the child committed that crime. So we have that procedural safeguard added into the detention hearing. There are some new trends that are affecting detention. Serious youthful offenders, I don't know if you all are aware of that, but now, believe it or not, juvenile court judges have the authority to sentence a child past the age of 19 up until the age of 23 and 24 in the adult system. Before that child can be placed in on the serious youthful offender track, that child is entitled to a jury trial. This is new. This law just became effective January the 1st of this year, and the SYO cases are starting to pop up. Not so much in Dover, in Stewart County, small, but they are popping up. In fact, in Davidson County, they had their first SYO case, I think like 4 hours after it became effective on January the 1st. So these cases are popping up. If the child wants a jury trial, then the child can be detained pending that jury trial. Think about how long it takes to get before a jury these days. Just think about that. So and we haven't seen that yet, but if I'm a defense lawyer and the DA doesn't offer me a good deal for my client, I'm going to insist on a jury trial. I'm going to try to fight this thing as much as I can. So there's a possibility that child may be in detention for several months awaiting a jury trial. The interstate compact on juveniles, if a juvenile comes from outside the state, a runaway, a fugitive from outside the state, then we are required to detain that juvenile for up to 90 days. Of course, we're bordered by a whole bunch of states, and so that does happen, especially in the areas like in Gatlinburg and places where there's a lot of visitors. That happens. School threats. School threats are a big deal. When I started this job 20-some-odd years ago, I didn't even know what that was. I took the bench just right after Columbine and knew that had happened, but it hadn't happened here. Well, folks, it's happening here. We're getting school threats. If Dover is getting school threats, then you know they're happening all over the state. And so a lot of judges and a lot of courts, myself included, will detain a juvenile on a school threat until we figure out what's going on, whether the threat is real or not. I have a couple of anecdotes for you. I'm a part-time judge. I owned a hardware store for 34 years. As part of my hardware store, I was a gun dealer. I sold guns for 34 years. I know what a rifle looks like. Just about 3 or 4 months ago, we had a Ring camera video sent to us by the police, and it showed this kid with a rifle with a scope pointing the rifle at a passing school bus, and the school bus was full of kids. I wanted to detain that kid because I didn't know what was going on. We tried 6 places and didn't get in. So that child went home that night under a whole lot of safety precautions and stuff. But I really wanted to put that child in detention until I could figure out what was going on. It turned out that the rifle was an air rifle, but it shot at 1,300 feet per second, which is more than a .22. And it's the velocity that kills, not necessarily the size of the bullet. About 2 months ago, we had an aggravated burglary where a child broke into a person's home, and I wanted to detain that child because there was a firearm involved. No bed available. We had to do something else. Last night, as my wife and I were enjoying our truffle fries at a restaurant, I got a call, and a young lady pointed a loaded gun at the face of her mother. I wanted to detain that child if things didn't calm down, but they went into the home, I was told later, and took the gun, took the child and put it with a relative, and so there was no need to detain. So that's the kind of things that we're looking at. We did have a stolen car and a DUI about a month ago. This youth was already on probation. I'm very familiar with the child's family. I knew his grandfather who died of alcoholism. I knew his father who committed suicide and was an alcoholic. His uncle is in my general sessions court, and I've got him in jail right now on drug charges. And so I know this kid doesn't have much of a chance. And so when he stole that car and wrecked it, I wanted to detain that child. We did find a bed there. It wasn't in Davidson County, thank you, but we did find a bed. But we had to wait 8 hours to get the kid, and it was a 2-hour drive to the detention center. So these are some of the kinds of things that are real world, that are happening. Again, if they're happening in a county of 14,000 people, I guarantee you, I bet you a hot fudge sundae, they're happening all across the state. Thank you.
Thank you. I am Sheila Calloway, the juvenile court judge in Nashville, Tennessee, right here in this place. And I am here today to talk to you about alternatives to detention. So we as judges see young people every day who make poor decisions in a moment. And the question before us is not whether we should hold them accountable, it's how we should hold them accountable, and what can we do that protects the community while giving that child a chance to get back on track. And so what we choose actually matters, because the wrong choice could absolutely entrench that young person deeper into our systems or give them the real opportunity to change their course. So when I sit on the bench, I don't want to guess about that child's risk or about that child's needs, just as Judge Brigham was talking about. That's why we use validated risk assessment tools. That helps us to distinguish whether that child is just doing something impulsive but is at low risk, or whether that child is truly poses a danger to our community if not closely supervised. So what that means is a 15-year-old who's shoplifted and has no prior arrest can be diverted quickly to community services, or as Judge Brigham was talking about some of the examples, these people who are facing violent charges absolutely need to be held until we can figure out what the next steps are. So assessments that we use make us smarter. They let us prioritize detention for those who actually need it and to direct the interventions to those that are at low risk of reoffending. Secondly, our partnerships with community organizations are not soft on crime, they're smart on outcomes. And so programs like restorative justice, individual family therapy, our credible messenger violence interruption programs, and mentoring help to keep our kids in school, in jobs, safely in the community, and out of our detention cells. So community connection is what keeps our youth out of trouble. So we see connecting youth to better holistic community connections as part of our job. When we give our youth structure and support outside the courthouse walls, the community sees the benefit and the community is safer. And so we also use diversion as a alternative. So most of our low-risk cases should not be in the courtrooms. Every unnecessary court appearance eats up our judicial time, family time, and taxpayer money, and often makes outcomes for our youth worse. And so our diversion programs are important so that we can redirect the youth each year into services that work better and cost less. And so diversion is not letting our youth off the hook. It's holding them accountable in ways that build responsibility without unnecessary court expenses. And finally, alternatives to detention are practical ideals and ease capacity issues. So as someone who has to balance full dockets with a limited number of detention beds, I can tell you that we need more than just the concrete and steel beds. We need flexible alternatives that are evidence-based and community-anchored. So, for instance, we need more services like intensive home services. We need trained therapists who work directly with our families several times a week. These models have national data showing that they reduce reoffending. We need day treatment alternative schools for our youth, educational and behavioral supports in structured settings so that our youth don't fall behind while their cases are pending. We need restorative justice and other programs such as that we're already using here in Davidson County. These programs work directly to those who are victimized and the victims of the crimes, and they make accountability for our youth visible and meaningful. So every one of the alternatives for us, at our cost, is $453.70 per day to house a youth in our detention facility. It reduces reoffending most effectively for most of the youth. And these will free up our detention spaces for the high-risk youth who absolutely need it. And so as a judge, I see the faces behind the children and behind the numbers. Our challenge is balancing safety today and safety tomorrow. Alternatives to detention are not a luxury. They are a necessity if we want safer neighborhoods, healthier families, and fewer young people graduating from our youth justice system to our adult criminal system. We have to have more alternatives as well. Thank you.
Wow, what an honor. I've never had this opportunity before, so I appreciate you spending your time listening to us. My name is Christy Little, and I've been a judge for 27 years and a magistrate for 4 years prior to that, and I'm only 40, so it's just absolutely amazing. Very young prodigy, but all right. I was sworn in 27 years ago as the judge, and my dreams had finally come true because I had a dream to help children in crisis. The day they began court, it was a surprise to me. It wasn't exactly what I thought and what I saw on TV. I thought that I would have some time to prepare to be a judge. Before I walked into court, my predecessor, Judge Walter Baker Harris, I don't know if any of you are familiar with him, maybe in Tipton County, he took me into his chambers, then my chambers, and he gave me one of his many words of wisdom. He said that a judge, and he said especially you, Christy, cannot have a bad day or make a mistake. Then he really got to me. He said sternly, the decisions you make today, can change a child, a family, or a beloved community, our community, forever. Wow. Every morning I pray for the wisdom to carry this mandate through each and every day. The juvenile court system in our state is in crisis. We have 27 years ago, I would have never dreamed of requesting and asking for more detention beds, you see, because I ran on prevention before detention. And I would love to get back to that. We have serious juvenile offenders that are too dangerous to remain in our communities now, as we see every single day. It is heartbreaking to me to see the rise in children sentenced for heinous crimes. Many of these children had lives fractured by untreated mental health issues, physical abuse, and lack of parental involvement. It's getting worse and worse. For more children, gangs have replaced positive influences. Our panel is here today in crisis mode asking for your help in intervening. More beds are needed for children whose offenses make them a risk to others and are in need of help and inpatient treatment. Evidence from judges' letters. I received a letter from every judge. We have a contract in our facility which has 8 beds. So from the Tennessee River to Shelby County, we have 8 beds, and then 3 in McDowell. So we have 11 beds in West Tennessee. 11 beds. And in Tipton County, I know the mayor knows how difficult that is, to have to take a child to Johnson City to place them. And that's simply because we don't have the space and our numbers are going up. And our facility was hit by a tornado and is off its foundation, so could close at any time, which would leave no beds for that part of our state. Many of these serious offenders are too dangerous to remain in our communities. And we are faced with many heartbreaking decisions with this rise. Our panel is here today asking for more help. Evidence from the letters of every single judge is in your packet. Statistics and maps show beds are unavailable, especially for pre-adjudicatory beds in rural areas in West Tennessee. The lack of pre- and post-adjudicatory services, as explained, leaves children on a path toward homelessness, which we see, and I know you heard about this morning, untreated mental health needs, and sadly, no hope. The state is unique in that every region has different needs. This new concept of working in regional settings is a novel change. It will allow judges, youth service officers, DCS workers, mental health workers, and others to get together to stop those current trends and focus on prevention. Children seem to know before we do what the next trend is, and we're always trying to catch up with them. We need to work harder to keep up with the problem. It is our hope that all 3 regions of our state can collaborate to address current problems and avoid future problems in their counties. This would be a first for the state of Tennessee and any state in the 50 states to have regional centers. And this would be something that we would be more than happy to share our many hours of work. The Western region is in desperate need for pre-adjudicatory beds, as the Middle and Eastern Tennessee may have other needs, such as mental health facilities, treatment facilities, pre and post. We want to thank TACIR. I cannot imagine the Hannah Newcomb, thank you. Nate Pettit, thank you. And the dearest friend I'll ever have in the world, Senator Jackson, from all my heart, thank you. Senator Rose, and then Senator Yeager. I haven't had the good fortune to actually meet you, but I've heard wonderful things about TACIR and look forward to working in some collaborative effort with all of you. Representative Littleton and Representative Moody will be the representatives that will be presenting a bill to the legislature if you find that there is a need. Today, the issue is there a need for more beds in the state of Tennessee? With what we have now, I don't see in what's in front of you, it would be difficult to find not. If we'd spend more money on our children and less money on building prisons, I think we'd be in a whole lot better shape. Just remember, as I always will, that the decision you make today, September the 18th, 2025, could change a child, a family, or your communities forever. Please help us support the need for more beds for our youth in Tennessee. Please, I beg you. This will require funding in this legislative session, which will be critical to our state as we deal with crime and mental health, which is what I see to be the next trend in spending. God bless our children. We ask that you help provide the buildings and services needed to save them by helping us by finding the need to, in order for the bill to pass that we have pending, that we have a huge need, obviously, that exists for pre- and post-adjudicatory beds. So prevention can now avoid detention once again. Thank you.
Thank you, Chairman and Commission members. My name is Jim Lehman. I'm the Legislative Director for the Department of Children's Services. I won't focus too much time on the pre-adjudication detention side, as the judges have done such a good job here of talking about that process. Our main involvement as DCS on the pre-adjudication side is we serve as the licensing authority for the state's juvenile detention centers and temporary holding resources. So we have 16 juvenile detention centers across the state, and I say we, not us, but the counties and juvenile courts do, and 4 temporary holding resources. So I'll just read those off just so that you know kind of where they are across the state, because again, that's only 20 counties with these types of facilities. Madison County, Williamson County, Davidson County, Putnam County, Scott County, Knox County, Washington County, Sevier, Blount, Ray, Bradley, Hamilton, Bedford, Rutherford, Shelby, and Dyer County. So those are where all of the juvenile detention centers are located across the state. The temporary holding resources, we have 4, and they are in Cumberland, Hamblin, Loudoun, and Sumner County. So I know the committee is focused on capacity. I added up all of the beds as far as the juvenile detention centers. It adds up to about 636 beds, if that's helpful for you all. And temporary holding resources is a category where the county can hold up to 72 hours. Those are at about 15 beds if you total all 4 of those up. So again, we serve as the licensing authority for those facilities, so members of our licensing team visit them on a regular basis to assess their compliance with licensing standards and rules, and work with them on any corrective action or on any deficiencies that could be noted. I'll move over to the post-adjudication side. So when children are adjudicated delinquent for committing offenses, depending on the number and or types of offenses, they can be committed to DCS custody, as the judges have talked about. DCS, we call these juvenile justice commitments, and so some fairly current numbers here. As of September 8th, we had 606 juvenile justice youth in custody. So of those 606, 145 were in a hardware secure facility, which is our most secure placement. 215 were in a staff secure facility. 40 were in a juvenile detention center facility. And the remainder were in community placement, trial home visit, or a few different other placement categories. So these numbers go up and down every day, but the first chart I have here shows our total juvenile justice custody trends over the last 5 years. So it's pretty hard to make out there, but the yellow line is best to see. That is by far the lowest number. That's 2021. You can see there was actually a downward trend of total kids in custody. But since then, fairly flat. The 24 got as high as 639 kids in custody, whereas we're a gray line that's kind of hard to see in 2025, but 606 kids, as of this month, as far as juvenile justice kids in DCS custody. Next, I wanted to share some information about the types of facilities that we use to house kids that are in juvenile justice custody. I won't go over every single one of these, but you can see here where those are situated across the state. Again, these are kids that are committed to DCS custody. So with the first two there, Walnut and Rosewood are in Davidson County, kind of near the airport. They are run by YOI, so that is a provider that we work with to staff those facilities. As you can see, Walnut is for females, Rosewood is for males, and the capacities listed there. If you go through the capacities, and that current date is as of September 6th, you can see that they're pretty close to capacity on most of these places. A couple of exceptions there. Rockdale in the bottom right corner, that is a facility in Texas that we use from time to time. We have not had as many kids in there recently, so on September 6th, there weren't any kids at the Rockdale facility. But each of these, it says, whether or not this is a staff secure facility or a hardware secure facility, and the capacity for each of those. And then again, on September 6th, how many juvenile justice commitment kids we had at those facilities. For the most part, these are facilities house just Tennessee-specific youth, Tennessee juvenile justice youth. They will, however, occasionally have a youth from a nearby state. If you total all of the capacity of all these facilities, that adds up to 425. With 159 of that being hardware secure and 266 of that being staff secure. So again, if you compare that to the numbers I listed as of September 8th, we had 145 DCS kids in hardware secure and 215 in staff secure. So, as you compare that to the total capacity. And then finally, this last slide, or we got two more, excuse me. These are the juvenile detention centers that we contract with to occasionally place kids usually while they're waiting to get into one of those other staff secure or hardware secure facilities. So these aren't all the juvenile detention centers across the state. These are just the ones that may have a DCS, juvenile justice youth, in them, so a kid that's been committed to our custody. These numbers, again, are as of September 6th. So in Madison County on September 6th, there was one juvenile justice kid at the juvenile detention center. Williamson County, there were 0. The higher numbers in Knox County on that day, there was 17 juvenile justice youth in Knox County, and there were 13 in Shelby County. So the numbers, I think this was on 2 days after the other numbers I said, but there were like 43 kids in juvenile detention centers on that day. And then finally, our assessment centers. These are a fairly new facility that we have been utilizing. So there are 3 different assessment center cottages in Nashville. Those will have, at any given time, I didn't have a current number there, they will have a maximum of 4 juvenile justice DCS youth in those facilities. Same with the Gallatin Primary Assessment Center as well. We will have occasionally a few more in the Bartlett Primary Assessment Center. I believe on September 6th we had 22 juvenile justice youth at that location on that day. So looking sort of to the future on, the capacity needs moving forward, we've been very fortunate that over the last few years, the Tennessee General Assembly has approved and funded a comprehensive DCS plan to construct several new DCS facilities, both on the juvenile justice side and the dependent and neglected side. over $300 million has been allocated to construct a new staff-secure facility at Woodland Hills in Nashville and a new hardware-secure and staff-secure facility at Wilder in Somerville, Tennessee. So that $300 million will go to all three, building all three of those facilities. The Woodland Hills property is located right next to the Standing Tall property that you see there, and the Standing Tall facility will continue to operate. The Woodland Hills facility is planned to have approximately 72 beds. The two new Wilder facilities will be built on the current Wilder campus, and the current Wilder facility will continue to operate until those facilities are completed. The Wilder hardware secure facilities plan to have approximately 72 beds, while the staff secures plan to have approximately 48 beds. So that will bring over 150 new beds as far as the post-adjudication side. And they will be constructed so that additional beds can be added to if there is an influx of youth in the system. So that's, again, high level, the current availability of housing and other treatment facilities for post-adjudication offenders that have been committed to DCS custody. And with that, I'll pass it along to Matt.
Well, good afternoon. Chairman Yeager, good to see you again. Members of the Commission, happy to be back this afternoon. It's really an honor to help present briefly on the work that we're doing specific to the juvenile justice population. It's also an honor to be a part of this panel. I've worked with several of the judges here, and they're for the best. And Jim's not too bad himself. So anyway, with me in the audience is our Director of Juvenile Justice, Elizabeth Reeve, as well as our Assistant Commissioner for Children and Youth Mental Health, Beth Goodner. So our department has a long history in supporting children and youth, but it wasn't really until 2018 that our department got involved with this specific population. So as you can see here on the slide, in 2018 it was the year that the Juvenile Justice Reform Act was passed by the legislature. And in that act, there was $4.5 million appropriated in recurring funds to help divert youth and families from further juvenile court and DCS involvement. I remember when this bill was being discussed, we were brought into the conversation, and having such a track record of working with children and youth, especially taking an early intervention approach, we were asked to participate in this, and of course we said yes. You can see in 2023, based on the success of our diversion programming, we received another $1.3 million in new recurring funding to increase the budget for this work. As the slide indicates here, the primary purpose of the juvenile justice reform grants administered by our department is to expand community-based diversionary programming and provide treatment options for juvenile courts to utilize across the state, specifically services and training that are evidence-based and outcomes-oriented. I know Judge Callaway talked a little bit about the importance of evidence-based work. Since the beginning of our involvement with juvenile justice diversion, we have partnered very closely with the Department of Children's Services, the Administrative Office of the Courts, the Tennessee Council of Juvenile and Family Court Judges, as well as the Tennessee Commission on Children and Youth. They've been very key partners in what we're doing, and I remember 7 years ago having a meeting with all of these stakeholders to say, how can we best use these funds to serve young people in our state? And their feedback really has guided our work up until today. This slide here shows you a map of where we're offering these services. As you can see here in the notes, the grant funds became available shortly after the appropriation was provided in 2018. We released an announcement of funds, a grant application process for providers to apply against. And we actually partner very closely with the judges and other key partners on developing the announcement of funding. And I'll talk here shortly about the goals of this program. As you can see, 6 grantees were selected back in 2019. These are tried and true community mental health providers, organizations like Youth Villages, Tennessee Voices, who Hannah referenced, Cary Counseling Center, Volunteer Behavioral Health Care System, the McNabb Center, and Frontier Health up in the Northeast. Since we've started with our diversionary programming over 7,000 youth have been served by these providers. A really important note here on this slide is that services are available to youth regardless of payer source. So this is a payer agnostic program. We know that over 50% of the children in our state are covered by TennCare. Approximately 45% have commercial insurance. There's maybe 5% of kids in our state who are uninsured. But this program serves all kids who may need diversionary work in their communities. Here you can see the program goals. The header states program goals. You can't really see it. But I'll read through these really briefly. The first is to divert youth from juvenile courts from further penetration into the juvenile justice system, using community-based services rather than commitment to state custody. The second goal is to establish, expand, and strengthen partnerships between juvenile courts, between community behavioral health providers, child welfare, local schools, youth, and families. That was something that I think the juvenile court judges early on really wanted to see be born out of this grant initiative. And then the third goal was something that I remember Judge Irwin from Knox County bringing up when we were developing this program. We wanted to ensure that these programs helped ensure the resiliency, well-being, and overall connectedness to the community for juvenile justice-involved youth. The targeted population I've touched on a little is really kids who are pre-adjudication that have committed lower-level offenses. As you can see here, these are children that have been referred to the juvenile court for delinquency charges. There's a risk of commitment to DCS with these children. Also, the children served by, the youth served by this program are those who have previously been on probation, pretrial diversion, juvenile diversion, are involved in pre-custodial programs or aftercare, and have reoffended or are at risk of being placed in DCS custody. And last but not least, children who have been deemed unruly or truant can also be served by the Juvenile Justice Diversion Program to prevent, again, these children from being placed into state custody. Here are the targeted outcomes of our juvenile justice diversion programming. The first is reducing the annual rate of out-of-home placement. That's been a primary goal of the providers and of this collaboration, to keep children out of state custody when and where possible by providing these community-based services. Cost savings, we know that it's often much more cost-efficient to serve a youth and their family in the community than it may be in a youth detention center. Improved quality of outcomes, again, going back to some of that early discussion that I remember Judge Irwin talking about, and then a reduction in recidivism. Here you can see our outcomes from this past fiscal year 25. They're notable. So of the youth served in fiscal year 25, 99% remained in their home. So they're not moving forward through the adjudication process. They're not coming into state custody. There was a 7% recidivism rate. We're following up with these youth 6 months after they complete their program, and that's how we're determining that recidivism rate. And then you can see improvements in just daily living activities. Our program evaluation team have assessed for this since the beginning. You see improvements in coping skills, communication, and just overall behavior among the young people served through our program. And I believe that's it. I wanted to be brief and short, but happy to answer any questions. Thank you. Thank you, Chairman.
And members, do we have any questions for the panelists? Mayor Frank?
First of all, I love hearing about that program, and I would like to hear from one of the judges if you like this program, the diversion program, and if you think it's working. Then two more questions. One for Judge Brigham. Is that how you pronounce your name? Yes, sir. So you mentioned some stories of immediate threat scenarios. And so for our adult detention centers, offenders are housed based on a classification model, and that can include something like a single cell where they're under constant surveillance monitoring for a health or behavioral issue. And I don't know, I'm not a lawyer and haven't played one on TV, so I'm wondering, in those type of high-threat scenarios for public safety, are we able under the law to house such a juvenile in an adult facility for a short term, and I know that the law does allow juveniles to be charged as adults. So I'm wondering if there are scenarios where a juvenile could be housed, obviously in a separate type scenario, for a temporary period of time under those high threat scenarios. And then my last question would be, so the public chapter 418 that asked for this study is asking about the need for additional capacity, and most everyone here today said there is such a need. So I will want to kind of focus in on whether that is private or public and the size of those facilities. So my mother, she spent time as an advocate for CASA. One of her main concerns was her children were at a larger facility, and she expressed often to me the concern she had, the experiences her children were having at those facilities. It wasn't about the staff or the guards, but it was about the other juvenile offenders that were in that facility. So I'm wondering, in terms of that and the developing mind, what is a better answer there, public, private, and the size of the facility? And I do not have an answer. I don't have an opinion on it. I'm genuinely wanting to know. So that's all, Mr. Chairman. Thank you.
You want me to take a shot at it? Okay. First of all, yay, CASA. Yeah. We got a CASA in Stewart County. It took me 14 years, but we got a CASA in Stewart County, and I love it. But CASA's on the DNN side, you know, the children that are abused, and we're talking about JJ kids here, juvenile justice kids. But right now the law is that we cannot put a kid in an adult facility. There has to be total separation of sight and sound. And that's not only in the cell, but also in the common areas like cafeterias, booking, and that kind of thing. So generally speaking, no, ma'am, we can't do that. Now, it's very interesting that you bring that up, because I'm a kind of a nerd kind of guy, and I was looking at some history, some reports from the early 90s and the late 80s, and there were kids in jails at that time. In fact, 8,000 or 10,000 kids at that time, if that data is solid. I'm not sure that it is. But now, that's a big no-no. When we choose to detain, there's a statute, 371114, 371116, that tells us kind of how to do that and which kids qualify for detention. And it's really a last resort for us, because all of our council members know that that's probably an adverse childhood experience being put into, juvie, a lockup. So I know for me, we go to great lengths to avoid locking a kid up. It's expensive for the county. $450 a day? Can you believe that? Right now we're paying $250, which is expensive. When I started, it was $112 a day. And plus the sheriff has to go and transport these kids to and from court, to and from doctor's appointments and assessments and so forth. So it's very expensive. The murder suspect that we had locked down was a 3-hour trip one way to the detention center. And so that was a huge amount. But I know, speaking for every council member I know, it's a last resort, because we know it's a big deal and it can be very traumatic for a kid. And sometimes they come out more streetwise than when they went in. And so, but safety of the public, that's what we're focusing on in this pre-adjudication phase. Not so much risk of flight. It's been my experience that most of the time kids do come to court. I don't know what their experience in the larger cities are. But public safety, you know, when you have a firearm pointed at you, and so we need these facilities in order to take control of the situation and calm things down. I'm not sure I answered any of your question, but there it is. I'm going to let some of these other experts.
In regard to the question about public-private, the facility that we're looking to build in the Western District would be every county surrounding that right now has to ship them across the state. Their parents don't get to see them. We have, as you could see, 7 beds that were on that last sheet. It would be paid through, the county would build the facility on our property. There's a pending House bill which precipitated this to determine that we do have a need, and I think 7 beds certainly is that need, but it would be a facility where we would also and I wouldn't agree otherwise, to work with the mental health. Huge CASA. I was the first president of CASA before I became judge, was involved with that. And to look at more holistic approach, keeping the gang members separate, making it, obviously, we have to be careful because so many people go, I guess you're going to just read to them and sit around and everything's going to be great. No, but we are going to provide them, they are children. And I think sometimes people forget that we're dealing with children. Now, they're children that may have done some horrible, horrible thing, but they're still innocent until proven guilty. So the facility that we're talking about would be a private facility owned by the county, and it would have 48 beds and would be around $70 million. If we'd have done it a few years earlier, it would have been a whole lot less. But nobody listens to me, so that's kind of where we are with that. I think everybody deals with their detention centers differently, but that's what we're looking at doing in the western region and making it a regional, not just Jackson, because we're the hub city. If anybody runs out of gas that steals a car between Memphis and Nashville, they're going to end up in Jackson. That's just, you can pretty much mark that. But that is what our goal is, and I think every area of the state is just so different. But that is our goal, our hope, and our prayer for that. And I don't know if that answered your public versus private.
And then, Mayor Frank, if I can add on the size, I think your mother is absolutely right. The bigger the size, the more problems.
Yes.
And so if the facilities could be smaller in number, if you put one child that's on the borderline and you put him in a facility that only has 8 youth that you're working with at a time, that has a better opportunity of being more restorative and more rehabilitative versus if you put that one child in a facility that holds 130, that child's probably going to end up in the same direction that the other 129 are going. And so the smaller the facilities, the better, but there's definitely a need for facilities.
Yes, and Judge Phil, y'all reminded me of another part of your question, which I probably ignored. But the intercept or the prevention money that came out of JJRA in 2018, yes, it has worked in Stewart County. We use Youth Village's Intercept program, and before then, I didn't really have an option to put somebody in the home that does what they do. So yes, that's been a fantastic program, and if you could triple it, that'd be great.
Senator Yarborough, you're recognized.
Thank you, and I'll start just by saying, Judge Brigham, I appreciate everybody on the panel and the work that you're doing, which is just massively hard. But I was particularly taken by the sort of the dilemma of, like, I've got to keep people in the community safe from a present threat versus like kind of the recognition of like this is going to be traumatic and significant possibility that they're actually going to learn more about how to be a better criminal in if they're actually detained. And I mean, and that's pretty backed up by data across the country. But I guess, I understand we have to increase the capacity, but how do we get to a place where whatever our capacity is less likely to lead to individual learning to be better criminals at this moment when they are literally in our custody, right? Like they are in like our collective custody. How do we actually make that not be the case? What are the steps that might be helpful towards, and like, do we have a sense of, which facilities are better or worse at that? Is there data? Like, how do y'all think through this from a court perspective?
Yeah, you just answered your own question there. Data. what you all are doing here, I've told Judge Filiaw, this is a once-in-a-generational opportunity for us to talk about this. You're not going to want to do this 5 years from now, redo this. This is amazing, and we are so grateful that you guys are doing this. But you also point out the need for data. Assess the services that are being provided in these facilities now and see what that data shows. I don't know what services are being provided in these facilities, but I do know that services like we just saw, 99% remain in the home. Now, maybe half of those wouldn't have gone into custody anyway, but I guarantee you some of that number would be in state's custody right now. I know in Stewart County that program is effective. I've seen it with my own eyes. I was skeptical at first. I was part of that JJRA discussion back in 2018, and I was kind of skeptical about that, but I'm not so skeptical anymore. So assess the services that are being provided now and see what that turns up.
Well, yeah. Oh, I thought there was another answer over there, but it's fine. Yep, it's fine.
Patiently, yes. First of all, as a retired law enforcement officer and as an attorney, I really appreciate the work that you do for your local community and for our state. So really do appreciate you. One thing that the study may answer it as well, but I thought while you're here, I might ask you, is there another different states model that doesn't mainly depend on the local governments as heavily for the detention? And how frequent are you unable to detain violent youth? That's just my question.
Mr. Pitts, would you repeat the second question there, please?
How frequently are you unable to detain someone because you don't have room?
On a daily basis. And sadly, all the local counties, we haven't been able to accept any of them in months and months and months because the crime, although everybody says the crime rate's down, serious crime rate is going through the roof, and you see it all the time with the murder. My executive director who runs the detention center, TJ King, and myself sit up most every night at 2 o'clock in the morning and discuss. We have two children in one bed. Both had loaded AKs. Which one, we look to see which one's been there before, which one was positive for drugs, and which one we think's family, will be more involved in helping us keep them on house arrest until we can figure out what to do next. And we made that decision a few months ago and sent the one home that the parents absolutely said there's no way we would let this child out. And within 2 days, we got a call from the funeral home, Mercer Funeral Home, saying, could we send someone up to take off his ankle monitor because he was deceased and they needed to take his body. He's 15. His body to the morgue in Nashville because he had been shot, and his parents had let him walk down to. He was at his house, but he was in the driveway. So we make those tough decisions just like you did as a police officer every single day. But in our region, 8 beds is just not enough for our county, but certainly for all the smaller counties that are having much more serious crime and unable to get that help. So I would never want to lock a child up and wouldn't if it wasn't the very last resource. And the difference is that I'm going to focus on the mental health piece, that one piece that we don't have that we need to spend more money on. Every child we have usually is functioning on one of the lowest levels, and sometimes are found to not even be competent. Most of them are on the spectrum at some point. We have a year waiting list to get to Lebanon, or 1 year. And so we need more services, and we're going to provide a whole wealth of those services through pathways, through, I know you met Vicki Lake this morning, and through the West Tennessee Healthcare to be able to do that, and also allow these small counties to not have to transfer them for forensics and other mental health. And I think if we don't work hard on this mental health issue, which we see every single day in all these horrible things that we're seeing on TV, it breaks my heart. We're certainly going to see it get worse. I see the light at the end of the tunnel when I know we can provide that plus education plus other services and not treat them the same as the adults are being treated in the jails. But if that answers what you were looking for, I'm sorry if I didn't, but I tried.
Thank you so much. Thank you all for what you're doing. Thank you for the presentation. It was fabulous. My uncle was a juvenile judge in Sumner County for 32 years, and so I've lived with the stories for a long, long, long time. But there's a couple of things that I think our police chief would appreciate me kind of adding to the conversation, just because it's a local government concern. One is that we repeatedly see juveniles who get arrested, and then when the parents, follow up, they can't believe that we've actually charged them because they've been released in other jurisdictions. They've just gotten a citation, whatever the circumstance is. So that would be, one issue I think he would want me to relay. Two is that, well, let's see my list here. The chief another complaint from him would be that, and I've gotten this call so many times in the morning, we arrested so-and-so last night. We couldn't detain him. There were no beds. I mean, that is very, very frequently a circumstance that we deal with in Sumner County. We had a circumstance, and this is the thing that I just never forget, is we had a child who had been charged with something fairly seriously, was on home detention, was supposed to be monitored by a parent, and got murdered because he wasn't being monitored by the parent, and there was some kind of gang issue that was going on, and he was not at home, and he was murdered in the community. And so that is very, very frustrating. So my question related to that, and you kind of inadvertently mentioned it in your answer a minute ago because you talked about the ankle monitor. And so I wonder if at the very least there could at least be some kind of monitoring when they are sent somewhere with some detention.
And I didn't want to step. No. We all use ankle monitors, I believe. DCS uses ankle monitors, but y'all need to update your ankle monitors. The children know, they go, I want one of those DCS ones because they can get them off. And we know that. It's like keeping ahead of the child concept, but ankle monitors help in the misdemeanors and some of the other offenses, and the children do not like them. I say it pays to accessorize, but they don't like that accessory most of the time. But and we can bring them in for a violation of court orders if they don't do what they're supposed to do. But getting them to charge the battery is very difficult. Also, we currently have 19 on ankle monitors. We have the ability to have more, but the parents won't follow up with what they're supposed to do, and our staff has to monitor 24/7, 365. And DCS doesn't have the manpower to do that. Our staff tries, but obviously we missed the one that died. And the children, children know when they're on ankle monitors, they learn some of the tricks of the trade, and we have to switch them up quite a bit. The ankle monitors do tell us where they are. However, they do not tell us who they're with and what they're doing. Mm-hmm. So 9 times out of 10, basically what they do is solve a crime for the police.
Well, then, and that is helpful. But then the other thing that we have seen a lot of, particularly with these smaller rashes of petty crimes like car break-ins, is that they have charges in every other jurisdiction. It's like they want to commit as much crime as they possibly can before they actually suffer the consequences of their actions. And then just kind of for the Children's Services, we have a facility in our city where it's actually children from other states coming to the facilities because the runners or for whatever reason. And it has had 3 different owners in my time in office. And the one thing I wanted to say about that was it really does matter. It really does matter who runs the facility, because we went through a period of time there where we had so many problems. And it wasn't necessarily the level of crimes the kids were committing. It was the ownership and the staffing of the center. That is all. Thank you.
If I may follow up on, I believe it's Mr. Peach's first question. The question was, are any other states paying for pre-adjudication detention? And I think that's a good question, and I just wanted to let you know that we don't have the answer to that, but we'll try to find out, and maybe TACIR may have an ability to do that. I don't know, but we don't know. Here in Tennessee, it's always fallen on the counties to burden that, to shoulder that expense, and we're just not sure about the answer to that question.
I'd like to follow up on that because one of you 2 judges commented on this in your remarks, and I was curious about the expense of the juvenile who has been charged and then put into a facility, so the county picks up the expense, the per diem for that. Until there's been an adjudication.
Until basically there's been a trial or
and how long is that period of time as a rule?
It depends. Typically, juvenile cases move much quicker than adults.
Yeah.
And so, we try to get those cases heard and finished within 30 days if we can. But I'll just be honest. If it's a murder case, if it's a transfer matter, if there's got to be evaluations done and getting an attorney to take the case and exchange of discovery and then potentially plea negotiations, I sometimes have them up to 90 days in my 26-bed detention unit in Chattanooga.
And I heard 2 numbers here of the cost per day of keeping a juvenile. One was $250, and the other was in excess of $400. Is this a reasonable spread? Or you're keeping somebody in your court for 90 days? It's going to cost you somewhere between $200 and $300 a day?
40 years ago, Hamilton County built a 26-bed detention unit. It's old, it's decaying, it needs to be replaced, but the county runs that. And so Hamilton County runs that. Judge Brigham, for example, does not have a detention unit in his county, and most counties don't. So he has to pay somebody else to hold his youth. And I believe what he said was, and y'all can correct me, I believe what he said was he's been paying about $250 a day for that care. And Judge Callaway's got a new facility coming online, and she's calculated her costs are going to be much higher. Is that fair?
I would like, Mr. Director Lickford, as a staff, I'd like to see the data on this, what the cost to the counties is, because I'm hearing that there is a range of cost because of different variables different to the respective counties. I realize that it will be the state's responsibility to build the center, but I'm hearing that it's the county's responsibility to pay the cost of keeping the child in the center, at least until adjudication. And then, correct me if I'm wrong, once the adjudication has occurred, does that cost shift to the state, or does it still stay with the county?
Yes, sir. Post-adjudication, we commit a child sometimes to the Department of Children's Services, and then it becomes an obligation of the state.
All right. I hope that staff I'd like to see those numbers. That could be a terrific expense to the counties. I'd like to see that if staff can provide those numbers, please. And I believe that there was a follow-up to one of Senator Yarborough's earlier questions that I moved on to someone who had been waiting. Was there another question for Senator Yarborough? Senator Yarborough, you're recognized, sir. I apologize for moving, but we'd had a gentleman who'd been waiting quite a while.
Oh, no, I appreciate that.
But it's your nickel now, sir.
Well, no, I mean, first, I just think I appreciate you letting this hearing go because it's the exact kind of information we need. The one piece, if I could follow up, I completely agree that it's good for us to get the actual cost data and sort of understand how that goes. But I also don't want to lose sight of what the kind of recidivism and long-term cost data is, right? Like, if you've got a facility that's got 75% of its people are going to be joining TDOC's state-run facilities at some point, they start becoming several $100,000s over the course of a lifetime versus, a slightly lower recidivism rate in those juvenile facilities just has massive long-term budgetary consequences. And I think this is exactly the kind of thing where you want to avoid being like penny wise and pound foolish in trying to make sure that like managing cost here. Nobody wants to spend too much money, but we also don't want to spend so little money that we're guaranteeing that we're spending more incarceration money in the long run. And I guess Mr. Lehman, I think the other piece I wanted to get to was, and this, if anybody else wants to comment on it as well, like, does the state's role of sort of licensing facilities actually make sense, if you will, like, versus actually paying attention to like what they're doing from a performance perspective? Like, how many students are actually like getting their high school degrees while they're detained? How many are getting treatment for known mental health problems while they're detained? How many are being rearrested within short time frames from being released from that facility? Because, I mean, I think sort of thing, if I'm just meeting like a checklist of licensing requirements, how does the state use that as a management tool to actually end up with the kind of detention that doesn't just lead to, recruitment centers for the vice lords, but actual interventions that might make a difference?
Thank you, Senator, for the question. And before I answer that, I wanted to say too, I showed a slide earlier. There's a dozen or so juvenile detention centers that we contract with. I believe our going rate is $185 a day. So if we have a DCS kid at one of those facilities, I think that's what we typically pay. 184, excuse me, 184.
We count our pennies.
To Senator Yarborough's question, I would say, that we do everything that we can within the parameters that we've been provided in statute, right? So is there, additional things that can be done in statute to make sure that we're checking for, additional things and that kind of thing? I would say as far as the educational standards, I believe most of that is up to DOE to check on, Department of Education. I could be wrong. Sammy she's confirming that's right. But as far as, what standards we have applicable to those facilities, I think our current rules are 50 plus pages of standards of, what the plant must look like, what staffing ratios there have to be, what services have to be available, that kind of thing. We have been in the process for a couple of years now of updating those standards. They do need to be updated. We made it all the way to the Government Operations Committee almost 2 years ago now. Ended up having to pull those to make a couple of tweaks to make sure that they would get approved by the committee. Those rules are currently with the Attorney General's office, so we are hopeful that those new standards will come online in the next couple of months. And those will just be more updated and modern standards to make sure that those kids are getting all the services that they should. I mean, the thing I would note is that juvenile detention centers, for the most part, are supposed to be temporary in nature, right? So there can be limitations on how robust all the services that they receive can be, but we do want to make sure they're getting education, getting, all the clinical assessments that they need and all that kind of thing. So.
And thank you, Mr. Chairman. And I'll just say for the report perspective, I mean, I appreciate that a lot. But I do think that we try to figure out what data we are looking at would be great so that we, if we're going to expand our capacity, it'd be good to know what capacity should be expanded versus which capacity should be curtailed.
Thank you, Mr. Chairman. Gosh, you guys see the worst of us all the time, every day. You have to make heartbreaking decisions that you have to take home with you. You got a tough job. So thanks not just for being here today, but thanks for the work that you do every day, dealing with what you have to deal with. I've got a lot of questions. I'll try to make them real short, Mr. Chairman. But first of all, in Tipton County, we're paying hotel bills for juveniles that are higher than the Peabody hotel rate in Memphis, and I'm tired of that. I hear from law enforcement officers out on the street that, listen, these juveniles, they're being convinced by hardened criminals to commit the crime for them because why? Those guys got no place to put you. And so I think that very fact has caused some rise in juvenile crime. I'm hearing that on a regular basis from law enforcement officers in my area. Right out of the gate, when you get to the gateway, when you get to you guys, we don't have places to put these folks. I mean, pre-adjudication, we just don't have places to put them. And so before you ever get into anything else in this program, we've got to have places to put these folks on a temporary basis so we can make the best decision. But I've got janitor staff that calls my office and says, listen, we can't clean the courthouse. We can't clean that courtroom today. When this morning there's a law enforcement officer that's there with the juvenile. They stayed in the courtroom last night. So there's a critical need for pre-adjudication beds where I'm from. Here's some of the questions that I have. If we were to build a juvenile detention facility in any grand division in the state, that's going to take a while. And you all maybe have touched on this. If you draw a radius around Tennessee, we're bordered by multiple states. Has it ever been considered, or is it possible now, or who makes the decision if County A in West Tennessee can contract with the county in Arkansas or North Mississippi or Southern Kentucky? Is that something that's doable now? Or are there objects to that? Or is there a reason why that couldn't be done if the contract were worked out between the local Tennessee county and the county and state A, B, or C? Anyone know the answer to that? In other words, if I'm looking for pre-adjudication beds, a place to put them, rather than take them to Sevier County, Mayor Waters told me today they've got, I think, 26 beds over there, and he thinks they've got 4 people in them. But that is a long way across Tennessee. Well, if there's Crittenden County, Mississippi, across the Mississippi River, can Tipton County contract to keep pre-adjudication juveniles in Crittenden County, Arkansas?
My guess,
for example,
would be no, because they would have different, obviously, juvenile court laws. We now have serious youth offenders that have to be housed separately. You're going to have violations. Plus, I think every state's in about the same situation that we are, in that they don't have the beds. Plus, they don't really want our. Sometimes they'll say they don't want our messes. I said, God doesn't make you junk, but you're going to have to work with us on this. And I would imagine that they're going to stick our state with much higher rates as some of these providers do that are outside the state. It's unbelievable what we're paying right now for those posts. We were 185, 184 for the state. Now we are, as of July 1st, we're $200 a day, and we also handle ICE and the other. Since we're doing TBI, FBI, ICE, and other major facilities, major individuals and companies such as, well, I know TBI uses this quite a bit, as well as now we're seeing a lot of immigration. We're the only immigration in the state. I can't imagine that any of the states around us would touch it.
Pre-adjudication of juveniles?
Pre-adjudication of juveniles, unless the price was right. Now, if you want to pay $700 or $800, I'm sure they'd be more than happy to do that, because some people are paying that now in Tennessee, where we're charging $200. I can't imagine. You're paying $1,200 to $1,500 plus for a child that has special needs, and that's low. So if you want to go out of the state and check to see what they're going to charge you, then I would venture to say the hotel is horrible, but is not going to be feasible to do that. And I don't know that it would even or could be done. I've never checked that, because that was never something that would have affected us.
Does anyone know on the panel, theoretically, if it were doable in terms of economics, are there any regulations that would stand in the way of that, or how would that work?
Yeah, Mayor, I've been checking with our general counsel, Sammy Mayfair's in the office. We can come back to you to let you know for sure, but we don't think there's anything prohibiting it. There are a couple of laws at play. The ICPC, the Interstate Compact for Placement of Children, would be involved. We have a whole team of people that do that when kids from our custody go to another state, or kids that are in custody in another state come to Tennessee. And then ICJ is the Interstate Compact for Juveniles. So they're different in that there's varying levels of red tape there as far as the movement of those children. But we believe that it's probably possible, again, if it's economically feasible.
But you see my point. If I can cross the river at the bridge and go to Crittenden County,
Sure.
Arkansas, versus Sevier County, that's you got to have an officer in the whole works. There's a lot of difference in terms of costs that I could, the county could absorb. The second thing I wanted to talk is about, Mr. Chairman, and that is not just the rate that we have to pay, but the length of time now for juveniles seems to be longer. And I think some of it's got to do with the requirements for a state psych test. Now, explain to me how that works is in terms of whether or not a judge is going to require a psych evaluation test for a juvenile, how that works, whether it has to be a state service or whether you can privatize that, or how would you speed that process up if you could?
If there's a transfer filed, a petition is filed, then there has to be a determination whether or not that child is mentally ill or committable to an institution for the mentally ill. And therefore, forensic has to be ordered, and Pathways is covered up, and they do them as quickly as possible. That's why we were going to have them on site, so all the counties could use them and have someone on site to be able to do it.
So that would be part of what
quickly.
Madison County is talking about. You'd have your own service there.
Yes.
That would be a private service, or would that be a state?
It would be Pathways.
Okay.
Pathways, and so they would bill TennCare, and that's how we have done that, and certainly we can do the monitor so that the judges can speak to the client without having to bring them back and forth until the hearing, if they choose to do that, where they would have them on a screen. And, other things like that we could work out, and that issue about Crittenden, it might help your problem, but it's not going to help the problems of these very, very rural towns like that, Crockett County or others, where, it might as well be in Timbuktu. It's not going to make any difference. And by the time you do an ICJC, even if you can get one of those Reg 6s and all this stuff you have to get to hurry them up, you're talking a minimum of 6 to 8 months. So I don't know, but The other problem, the biggest problem with that is, and CASA would know this more than anything, is you got a child, even if it's in Tipton County, how can that parent visit that child? We have people, we have visitation every night. How can a parent go visit a child in another state when they don't have public transportation to even get to the detention center? And we were going to also, that was one of the things we were going to look at, is trying to help to get those parents there, because it makes such a huge difference in the psyche of those children to be able to see mom and dad, especially if they're 13 and charged with first-degree murder. And we have 2 of those. So we have to look at that. I think the going outside the state would not be anything the Western District would want, in my opinion.
Yeah. Thank you. Mr. Chairman, just one last question, if I could. If there's a local area, if a local town has got space in its justice center, for example, that says, listen, we can temporarily, hold juveniles here. This can be a pre-adjudication facility here. The town's got it. Now, we don't know how that process works, getting that approved. How does that process work? Who comes in and decides what that town has got to do to be able to use that facility for pre-adjudication holding?
That'd be our licensing team. They'd have to, show that they're meeting all the rules and regulations that we have promulgated about what standards a juvenile detention center has to meet in order to operate. Yep.
In a temporary facility, are there educational requirements?
I'm not sure about the education. There are the temporary holding. Yeah, Judge Little would know. I know they're only supposed to be there up to 72 hours, but I guess. Yeah.
Well, are you talking about temporary, like 72 hours? You're talking about
Yes.
They still have to have the educational requirement met, and the school system would have to provide a licensed teacher, and then and no offense, but the checklist of what you have to have is unbelievable. We have worked years and years and years just trying to come up with a plan that would work for our county, and with less beds, and it is phenomenal, the requirements that it takes right now. I don't even know how many requirements you have, but it is unfathomable what it's going to cost to get all that done. Yeah. And I've lived it a long time, and it's really difficult. It's really difficult.
Thank you, Mr. Chairman.
Thank you. You're quite welcome. Are there others before we bring the curtain down? No other questions. I really appreciate the panel. I wish that we had a Nobel Prize for General Sessions and juvenile judges. What you do is just so good. We appreciate your service. And if there ever was a public service, it's our juvenile judges. What you deal with every day takes a special person. And we've seen that through your testimony today. So thank you very much for what you do and for your sharing your thoughts and recommendations with us today. We deeply appreciate it, and we'll give it very serious consideration. With that, members, I will turn the podium back over to Director Lippard. I think we have a matter of other business. Is that correct?
That's correct, Chairman. And actually, the only other business is setting our next meeting date, which will not be next month, as stated earlier. And we'll be polling the members. Plan on, if you're looking at your calendars, we'll, as we normally do with the winter meeting, we'll try to plan something for early December. Actually, it's technically our fall meeting. But
any questions? Are there any questions for the director? Thank you very much, members. Thank you for coming today and your participation. And if there's no further business to take, we will stand in adjournment.